हेलो। of AI. We had seen that Madam had discussed about the revised curriculum by INC, simulation-based learning, the national role in digital health and AI summits. Also, Madam highlighted that the Telemedicon 2024. Thank you, ma'am, for inspiring us with your thoughts.
Thank you. Thank you so much.
Thank you, sir. We now take a moment to appreciate moderator's contribution. I invite Mr. Yogesh Bhosle, Faculty of Nursing, for the moderator's felicitation. Our next session focuses on evolving leadership roles of nurses in the rapidly advancing world of artificial intelligence. We are pleased to have Ms. Francie Francis, lecturer at Sultan Qaboos University, Muscat, Oman, joining us virtually for this presentation. I invite a session moderator, Mrs. Archana Dhanavde, Faculty of Nursing, to lead the session and introduce the esteemed speaker.
Thank you, Nikhil. Now I'm going to introduce today's guest lecturer, Ms. Francie Francis. Madam is presently affiliated as a lecturer in the MCH department of College of Nursing, Sultan Qaboos University, Oman. About her background, Madam has done her MSc in Tamil Nadu in 2012. Currently, she is pursuing her doctoral program from Sri Ramchandra Institute of Higher Education and Research. Madam has Madam has received honorary award for the research and scholarly activities in 1617. Also, she has received Anthony Battaglia Pocket Nurse Scholarship Award in 2017 at Washington, D.C. Madam has got the Best Oral Presenter Award in 2018 at 6th Annual Worldwide Nursing Congress in Singapore. Madam has Best Scientific Poster Award in 2019 in the 3rd International Conference and Advances in Obstetric and Gynecology at Muscat. Madam is so intelligent, like her highlights on Madam has, along with the team of colleagues, she has developed a board game, Hop On and Slide Off, as an active teaching strategies for the students. She also co-authored a book, Fundamentals of Midwifery and Obstetrical Nursing. Madam is also a poetry. She has written a poet titled on the Taking It Slow, Self-Care, Biggest Care, and has been published in the Journal of Art and Aesthetic in Nursing. Really, Madam has a wide and variety of experiences, but due to time constraint, I have cut shorted it. Madam, we would like to know more from you about the today's topic, that nurse leadership in the AI revolution. Thank you, ma'am. Over to you.
I thank you for the time that's taken to concise and present and introduce me. Am I audible? Are you able to hear me?
Yes, ma'am.
Okay. So I have made a request to present my recording, but I am available here, and I'm so happy to see a hall filled with so many youngsters. This is your era, and all of us of this age are fighting with the newest technologies to make sure we will occupy you and make sure your learning is better. So I hope you will listen to the sessions, and then please feel free to interact. I'm virtually available. That's not my usual style. I would love to network, would love to see and meet each one of you and get to make new friends. So I would love to have some questions also from your end at the end of the session. Over to you, sir, if you can project my recording.
Yes, ma'am, you are doing.
If you still find if there's any technical issues, let me know, sir. I can do it online also.
Ma'am, you can start the online. We are trying to get it.
You want me to start online?
Yes, ma'am.
Okay, so I'll share my slide from here.
Yes, ma'am. Wait for 2 minutes.
Yeah, can you give me the host?
Yes, ma'am.
Madam, we have make you host.
Yeah, is my PowerPoint visible? Are you able to see my PowerPoint?
Yes, ma'am.
Yes, ma'am. Yes.
Okay. So a very good morning to all of you seated there. I'm sure all of you have set this time aside so that you can have some glimpses on AI and the presentations yesterday and today. And I thank Dr. Srilekha. I think she did half of my job. Most of the things were covered. And then it was also enlightening for me to know there's a lot going out in AI. Is there a disturbance? Someone online is not unmuted, I suppose.
Madam, you can mute them from your side. As I am not host, so I am not able to mute them.
Okay, let me see if
Uh,
I'm not able to see that
all the
actually.
participants, those who have joined online, kindly mute yourself. Mrs. Nikita Suryavanshi, kindly mute yourself.
Okay. So thank you for bearing with that. Let me go back. So the topic is they asked me to explore about nursing leadership in AI revolution. And this really set me on a thinking mode. The word leadership, because have we reached there in the nursing field was the question that came. So I asked myself, can I ask the crowd, do you know what's the difference between a boss and a leader? Is there someone willing to answer the difference between a boss and a leader? No one wants to answer? Okay. So I know it's very, very challenging. Maybe some of you have your bosses and leaders sitting out there and you are afraid that you might land up in some trouble. Okay. So let me take you there. When I thought about this word, this picture really gave a good insight onto what could be the difference between the two. though in nursing, we do not call them as bosses, we call them as either nurse managers, we have it as head nurses or different people in the hierarchy on above us in case if you're not holding a position. So this picture makes it clear. So the difference here is there is a boss and there is a leader. The leader is someone who stays with the team, goes forward, tries to bring the team along with them and try to achieve success. Now, a boss may or may not be, I do not say that all bosses are like this. They may or may not be. Usually, we see them as a picture where they only direct. Maybe they do not know enough or they have more knowledge, delegation. So many things are being referred. But I would say that these words are used interchangeably, and the expectation of the role is a boss should always be a good leader, and a good leader should be able to be a boss as well. Otherwise, leading the whole team to success is challenging. Now, another big difference is usually boss, they have power, and leaders, they always have the people with them. So anything that's been told, they'll be able to implement and take it along in a much better way. So do you think a leader is someone who might not have failed at all? Never, because to reach that position, I'm sure they would have given multiple tries, lost many times, learned from those mistakes and failures, and then lead a team. Now, why these words and terminologies now? Because the topic talks about revolution, and a revolution is something that needs someone to lead the change. Someone who's there should lead the change, and there will be a lot of resistance when a new thing comes into the curriculum or the practice. There is a lot of resistance from the people who are using it. So they need to really make sure settle the environment and achieve the gains of AI, which is truly a revolution. Now, to just define it, I picked this definition and I felt they really fit in. Specifically, AI, when it comes to AI, there is ethical issues that is revolving around it. Then you have strategic problems. Miss Nikita, Miss Nikita Suryavanshi, not able to move from here.
I request Delegate Suryavanshi, can you mute yourself?
Maybe if I unshare my slide, I'll be able to, because I'm not able to see the tab for myself.
Yes, ma'am. Actually, it
नंतर ते आम्हाला बोलतात की
As you are
senior
the
विद्यार्थी
coordinator.
कार्यक्रम 8 वाजले असतात का त्याला की नाही आम्ही तर गेलो पाहिजे त्या फोटो काढतात नंतर आता तरी आता थोडा हवा
Ma'am,
Just a minute.
केलाय करायला की तर मुलाचा रिझल्ट
yes, ma'am.
अभियंता ते ग्लोरीचा रिझल्ट आहे 11
Yes, ma'am. Click on three dots and you can remove the delegate.
These are the three dots, right?
No, ma'am.
खाणार काय
Just go.
कोण नाही म्हणून नाहीतर मी आणि गावठी बसले कोणच नाही
Because I'm only able to see these options like in the three dots, docs, notes, whiteboard. Like.
Ma'am, can you
चहा प्यायचं होतं जरा चहा आणणार काय आम्हाला
Yes, ma'am. Now it's okay. We have removed that person. You can continue.
Okay. Thanks for doing that. I think she was not aware that she was online. Anyway, it's often happens with us.
Thank you, ma'am.
Okay. So let me go back and share. Okay. Okay, so these terminologies, these are very important, these three words. When it comes to leadership, you have ethics, you have a strategy, and the most important is compassionate integration. See, now most of us, when it comes to technology, usually we fear using it because we do not know how to use it, or we feel that we are not good at it. That's when you cannot accept or do it. But this needs a change of mindset because the world is going towards it. If we do not learn it, we will be left behind. And we should have the passion and the compassion to use it in the right way, not always being on the side that says this is not good and induce fear in ourselves. So this can happen in nursing also, but it will slowly seep into, and we will be able to be independent users. Why it matters? We always have been proud that nurses are the largest healthcare workforce, and often they are the ones who are directly in contact, be it in education with the students, be it in the community with the community people, be it in clinical practice, it is with the bedside patients and at the bedside. So we have been always present there for longer hours. So we are the only ones who can, even if how many ever AI tools or gadgets, whatever comes in, we have to learn to implement them. What is the role of leadership? Just to make sure that AI aligns with human centered care. The current prevailing fear is AI might replace us. And I would always say no, it cannot replace us. No robo nurse can do what a human nurse does because it deals with emotions. And at one point, it's always technology. We do not know what can happen at any point. So we always have hold when it comes to patient care and teaching students. So only thing is it needs to be human centered and not totally relied on whatever that comes. We need to go hand in hand. AI should augment us so that our workload becomes easier and no more nurses complain about burden. So if nurse is not involved, definitely we are taking risk into our hands that will reinforce some bias, and some patient needs may be compromised also. Now, I just like fun. I asked Copilot. This is like ChatGPT Copilot. I asked how many nurses are leaders in AI in India, and this result is from ChatGPT. There is no published statistics. Probably we have started doing it, but we haven't come to a level that we have reports that is being generated. There are some emerging roles, and it brought some key figures. I get to know that many things are being done, but Max Health, I think they have initiated a course, and that's why this has popped up. Now, would you like to be an AI champion? Of course, there is a lot of opportunities in the field of AI now. The reason is because there is a gap that is existing. We are still learning what is AI. We are trying to see where can we fit in and how we can use it. And definitely there should be someone who's going to master AI in nursing and who's being able to lead another set of group of, just like this conference today. You see, it's been organized 2 full intensive days to know what's happening in AI. And I'm sure at the end of this, you make your decisions whether you have an interest towards knowing how to integrate AI. While when you compare the context between global and India, globally always they lead the path. They have resources, they have funding, they have so many other benefits which makes them to grab opportunities faster, implement and go about. While for us, we might be on a slower pace, but I'm sure India will do it always the best, coming out with best things that can attract the global attention. Now, I divided the roles into different areas like this. I will make a quick view on this. AI education, most of the aspects were covered by Dr. Srilekha though. But I want to highlight the leadership role. So every segment of my presentation will have a leadership role highlighted. So as a nurse leader, what would they want to have it done? First of all, we definitely have to do a curriculum redesign, and I saw that a doctoral program has integrated it already. This should also happen from the undergraduate levels. Slowly, the curriculum is redesigned, allowing certain percentages of AI use to write assignments, assessments. I know this will bring a lot of smile in the face of students, especially because you close your eyes and your assignment is ready there. But that will not be the case when it is coming into practice. There will be policies, there will be guidelines which will state how much percentage you can use, what are the allowed things. You cannot give your whole brain in control to AI and say do this for me and you do not know anything about it. That will be the threat. You will not know what you're doing and you will not have that knowledge which you will have when you do it hands-on using our own creative brains. So curriculum redesign will have integrations of AI. Now you have multiple subjects, it will get integrated into different with rules and guidelines. Of course, faculty training is very, very important. This is an overview. Maybe the conference is just a beginning for you all, but you have to look for specific areas, more detailed step-by-step trainings to have better mastery. And ethical literacy. So anything technology, it comes with ethics. We should have our conscience saying us that this is okay, this is not okay, and self-reflect before we publish or do anything just by using AI. Now, a simple example is like now, what is the situation of teachers like us? We are groping. We are thinking, how are we going to control this? Maybe now itself, all of us have started seeing assignments coming in full form. Probably that was a student who didn't know to frame a few sentences, but you see them writing very, very beautiful assignments. So, the always believe that how when we use a Google map, we are the ones who decide the destination. The car drives, we drive, we follow it. Students are like this, they choose their path. But as for teachers and educators, we have to decide how much they can do with it and what is acceptable. Some examples are like smart dashboards that are there. AI tutors are available. These are examples of AI which has been done in nursing field itself, and I would like to give you one of the examples. This is a Good Nurse. It's an AI tutor kind, and it was developed in the US by nurses. The why I chose this one is it was done by nurses for nurses. So nurses can do this independently, and they developed this to train students on NCLEX based questions. In US, most of them after their curriculums, they have to undergo NCLEX exams compulsorily. So they have developed this as training. So this is one good example which can be done in India as well. And then this is from my university. We have been having AI trainings for the last 1 year. And these trainings in my university, we have around 9 colleges of different disciplines. But when certain rules come out, we all have to mandatorily follow it. So every faculty mandatorily had to attend a certain AI trainings that had been given both in research and education, and it had multiple sessions, and they ensured that all the faculties, I think we are around 2000 3000 faculties which is across the universities in the academic side alone. So we have been all attending sessions the last 1 year. Now this year they opened out something called as a higher education generative contest. This is open for students, staff, everyone, and they wanted to see what have we gained and what do we have. Those who are interested can participate. So we took a chance, and this time we presented. Our idea was a smart AI learning analytics dashboard. The one that I have proposed here is FEM 360, is a Arabic name. It means understanding. So we were 3 nurses only, and we didn't think that the idea would pitch to the next phase, but we put the idea across. It went to phase 2, but from there it started. When we reached phase 2, we were given intensive boot camps how to build our own product, the prototype and the product using AI. So that sessions, those specific sessions really helped us. We moved to phase 3, and we were able to build our own product that involved the university and the student information systems, and then it was able to generate smart, personalized, customized learning templates for the students, reports for the teachers. It also had learning reports for the deans. So it was able to bring things, and we presented it in phase 4. Totally, they received for 57 applications. We were among the 12 that were selected, but of course, we did not win. We were happy with the participation we had because we were only nurses, while all the others who competed, many of them were computer science and some of them were AI specialists. So I learned that being alone, only nurses, we cannot go forward. We need to have an interdisciplinary approach, which is again the need for leadership. They have to be, you cannot be within only our area and then say I can do multiple things. We need to seek what is best in others to make our ideas come alive. AI in clinical practice, also similarly, the main leadership role here is it's about advocating. So we saw a lot of innovations that's coming in clinics. You might be a witness of it, a part of it, sometimes to assist it. So what a leader in nursing clinical practice should look for: advocate for safe kind of AI use, equitable, safe AI use. It should be available to everyone, irrespective of their financial status. Whatever is the innovation that's coming, it should benefit all around, and it should be implemented with utmost care. So this will be the highlighted leadership role. like a smartwatch. We all have smartwatches these days, but I am sure nurses or nursing students or someone related to the medical field will understand those numbers better. If our heart rate goes up, okay, okay, it's gone up, but not for someone who does not have the knowledge behind it. So it's in the similar way, AI helps to monitor patients and all those things are true, but the data and the interpretation can happen only with people who have knowledge related to those values. Some examples already quoted before, predictive analytics, and then the one that attracted me is the voice to chart tools. These days, with accreditation coming in, we have a lot of documentation. Most often, nurses have gone into only documenting and creating lots of files. Rather, the time spent with the nurses, with the patients, are decreasing slowly. So, this voice to chat tool, I found it interesting. It might reduce our burden. You only have to talk and then it will record it for you, which is interesting. And they have already made one like this, which is available in the online. Of course, all of these are all, since it's made, it's all monetized, so it's all having a certain payments, but it's an example which we can always think about in applying in our country. This is another one similar to ChatGPT. This is like Nurse AI. It's like a ChatGPT or Copilot. You can ask anything that's related to nursing and it gives you an answer. So it already had an auto-generated 4 questions. And since we were talking about leadership, I just chose what are effective leadership skills in nursing, and it gives you a lot of core skills in very, very small, concise, bulleted format, which is interesting to read. For a quick reference, this might be good as well. This is free. AI in community health. We all go for community postings. We go and try to reach the population that is not able to come and access us. We have a nice primary health center, all these things running. How can you use, or what is your leadership role? We need to start developing culturally sensitive and multi-language adaptable contents, or AI usage contents. Mostly it will be like mobile apps, things which can be easily used by the end user. So this will be many interesting things can be done in the community level also. Like it's like a multilingual friend. They can have an option to do this. Currently in my research here, we have this option. I said I was doing PhD. My outcome, my intervention is I developed a mobile application. This is for primarily focused on the first time postpartum mothers, and all the topics they require are there in the mobile application. We added a key feature which is using AI. Now, whatever queries, the user can post queries into it, and they will be able to, the AI will analyze only from my content, which has been incorporated into the mobile app, because that content has been reviewed, approved by subject matter experts. So it will only bring from them, not from random areas from anywhere in the online that's available. So this way you can also limit and be sure that the information is right. Mine is multilingual. It's bilingual. It has English and Arabic, and my target is to look for the Arabic women, to benefit the Arabic women who know only Arabic but no English. Now, the other examples are chatbots and AI-powered mobile apps. This is one example that I served now. We also have a website called Bot Pen Queen. This helps you to develop a bot by yourself. The first attempt is free. When you need more primary features, you can pay also. AI in nursing research, this we don't have to talk about too much of. I think in nursing research is where we have had a lot of AIs coming in, making life easier for publishing. I think the teachers here will agree that if publication has been a criteria in your appraisals, then we are all, it's like publish or perish. So all of us know what we are looking for in AI research. What will be the leadership role? We drive innovations. We use those innovations in AI that are available, but always hold ethical standards, which is important. So it's like, it's very easy. Now, if you go to a librarian and you say that I want to read magazines or I want journals on these things, he'll be able to lead you to that place and say the journals of your section are available here. Or if you ask them to develop a search strategy for your literature review, they do it for you. The same thing is now done by AI. So you ask something related to this, it generates. You ask it to outline a proposal for a research paper, 2 minutes, it is there. So this is how it's been helping us, but we have to see which is right and no. So I understand the scientific community, the journals are still trying to figure out ways to curb. Now it has conversational AIs have conversational kind of talking platforms, natural language processing. It can analyze narratives, machine languages that can help identify chronic diseases. Like if it's in the clinical practice, you have certain pattern for certain geographical area. If you give those details to AI, it can also help to bring out a pattern which is there. And most importantly, you see it in assisted academic writing also. Now, what happened? AI innovation in nursing research. Every day there is news like this. There is lot of papers. Someone who has been publishing only 2 papers in one a year, because I think it takes that time. By the time you implement the study, you start sitting even more than that, and the journal keeps with them for even more time. Have started publishing 1 paper each month. So this is where we have to cut the line. Now, what are the competencies that is required if you are charting your path to become a leader? Please make sure your AI literacy is good. Grab knowledge until you are confident enough to share it with others and to lead a team. Ethical stewardship, make sure that you're transparent, ensuring transparency, privacy, and more important, to declare that you have used AI as your assistant. It should come with pride, not that AI is being secretly used and then you own that talent, saying it's me who has used AI. I means I have not used AI, but it's me. Don't claim that. It's like same like plagiarism and similarity index. Collaborative visioning, very very important. You can never now work only as nurses. We have to collaborate with everyone. Sometimes they have other powers that can escalate our idea into a practice. And change management, in it's guiding groups. Now we have different kinds of people, staff working, from baby boomers until the Gen Z, and soon the Gen Alpha will come. All of us have different mindset, different digital skills. It's very important to cut through in a very very nice way, so that it sits well with all of them and everyone is friendly and comfortable in using the new revolutions that come. It's a gentle reminder, every nurse is an AI nurse, of course, because we are not coding any product, but we care. So leadership means to shape AI to serve humanity, but not to replace it. Now, these were a few publications that I referred to because I wanted to exclusively look into also what is happening in the administrative and leadership levels. You can also try reading it. It's interesting to read them. This is the course I saw that's available in India. Hopefully, one day even I will be able to do this. It's got a very nice curriculum. It's offered by Max Healthcare, postgraduate diploma AI in healthcare. It's for 1 year and has examinations and things, I think. But it would be a good learning if someone who's interested wants to do this. This is another one offered by Aster Health Academy. It's only short, 3 months. It's also available in, you can pay it in Indian currency also. And it gives a quick view of what is required, offered by Indian Institute of Science, but it's related to healthcare. And this is available in Coursera platform. It's paid, of course. This was interesting. I have done it by myself. The course helped me understand the different aspects of using AI in teaching. It's general, not nursing, but still it gives all the tools that's required for us to integrate it into the nursing education. It had 4 different courses. Each courses are paid separately with graded assignments, but at the end of completing 4 courses, you get a specialization. Thank you, and I hope you have got quite a bit from my presentation as well, and I'm open for discussion with me. And I open my email, and anyone who's interested to connect with me professionally can do that also. Thank you so much. I'm open for questions. Love to hear from you all. I can see a lot of students sitting out there.
Yes, anyone has any questions, please you can ask. Or you want to discuss anything with the ma'am, you can. Anyone has a question?
Okay, if you don't get it suddenly now, feel free to contact me by email and I can respond patiently to your queries as well. Thank you.
Sure. Ma'am, thank you so much for your, you have enlightened us from your vast knowledge and the experiences. And also you have said how nurses can prove as a leader excellently with the help of AI. First picture, ma'am, caught my attention that nurse is shaking hand with the robot, that is AI. And really, now we are leaders and how to become a leader with the AI. So we have to shake a hand with the AI. Okay, we should.
And to just tell you that picture was made using AI. I gave the prompt and it generated that for me. So this is how, in one way, I'm integrating. Now I don't go behind those pictures which are copyrighted. You make yours and that becomes yours. Only.
Excellent. Excellent. Ma'am, also you have emphasized that how to be a leader, leadership. Okay, what the qualities leadership should have, that the ethics, strategies, and compassionate integration of the technologies. And really, this we should have everything with us, and then only we can go ahead. Ma'am, also you have emphasized on why AI matters in the nursing. Also, how to be an AI champion. Ma'am, you have emphasized on the leadership role in AI, that is in the education, in clinical practice, in community health. It's very important as we are writing a research proposal or writing a research publication. In that also we are writing. And also in the AI education, how what is the leadership role we have to perform that? Madam, you have explained about the leadership competencies, and also you have emphasized on the courses, what all the courses are available to be a master or to be a champion in the AI. So almost everything you have covered, ma'am. Thank you so much for enlightening us with your knowledge and the experience. Thank you so much, ma'am.
Thank you so much for being such wonderful hosts and accommodating my request of being online. I would like to thank Dr. Suresh. I have not met you in person, but very good communication, and you made sure everything had to run smooth. But there was some technical glitch, but this is always expected from our end. I hope the rest of the day will continue fine. And to the entire faculty team who's supporting him, it's so evident that it is running nicely, well organized, and hope sometime I will be able to see you in person as well. Thank you so much.
Thank you so much, ma'am. This is Dr. Suresh.
Yes, thank you.
Your session was wonderful, very much practical, thoughtful audience, and all the way that you have graciously accepted our invitation for this conference. That's so nice of you. Thank you very much, and it definitely will enlighten our audience, and they will implement in their day-to-day settings. Thank you so much.
Sure. Thank you. Welcome, sir.
Thank you so much, ma'am. Next time we would like to know you from face to face, ma'am.
Yes, yes. Dr. Suresh can do that for me when I come for vacations down there, because these days the air ticket prices are worse than gold. So when I come down in vacation, we can definitely plan a meeting and we can have it.
Sure.
Sure, ma'am. Thank you. Thank you so much.
Thank you, ma'am. As we conclude this session, we also acknowledge the moderate significant role. I request Mrs. Seema Gedugod for moderator felicitation. We now continue with the session focused on regulatory policies dimension that will shape the future of AI in public health system. We warmly welcome Dr. Rupa Rawat, Regional Nursing Lead for the World Health Organization, Southeast Asian region, from the Jai Prakash Narayan Apex Trauma Center, AIMS, New Delhi. She is present with us today. I request the moderator, Mrs. Shilpa Satralkar, Faculty of Nursing, to lead the proceedings.
Good morning, everyone. Today, I is from New Delhi, GPNATC AIMS. It's our honor, ma'am. Your remarkable contribution to nursing field have been a big about ma'am. Madam has a total of 18 years of experience. 13 years of experience in corporate healthcare administration, training, quality improvement, research, 5 years of experience in public health project management, quality accreditation, assessor, program designing, and success execution consultant in international agencies. She is the first trained rheumatological nurse in India. That's a very big achievement, ma'am. At present, Madam is a regional nursing lead at AIMS, New Delhi. I welcome you once again, ma'am, on behalf of Bharati Vidyapeeth College of Nursing, Sangli. With her vast knowledge and expertise in nursing, she has earned a global recognition. We are privileged to have you share your insights with us today. I request you, ma'am, to share your word with us on policy and regulation public health. Thank you.
Very warm good morning to all of के बाद आप लोग कितने टायर्ड होंगे? How many of you comfortable with Hindi? Please raise your hands. I'm too fluent in Hindi. So I just want to save my soul if my Hindi will slips out of my English. Okay. And how many of you comfortable with English? Hindi, English both? Okay. So I was just asking organizer if the lights will be on from this side. So आप लोग ज़्यादा जग पाएंगे. And off on this side. Yes, my slides, please. Few disclaimers. I'm not doctor. I didn't do any my PhD so far, and I proud to be a registered nurse. So I'm a public health nurse nowadays, and my नहीं किया उसके बाद मेरी स्लाइड छोटी थी बहुत कुछ लिख दिया that's all you can forget. So most important, and before starting my presentation, this or wherever you are, where all you can go. Oh, ये नहीं मेरे को लाइक्स बढ़ानी थी आपने कम कर slides please. So basically we are all over the world. So this is called WHO collaborating centers. So WHO sits at Geneva, and wherever organization is doing good work, they collaborate with that. So AIMS का जो trauma center है, उसका emergency department is collaborated with WHO. Organization. So as a organization, it is WHO Collaborating Center for Emergency and Trauma Care, and we work not only for India, for the 11 other countries. So I'm a regional nursing lead and taking care of regional nursing work for the India, the 11 countries. With that, I am too keen in working to system strengthening. Another, my interest area is rural and tribal. So probably I will not be more emotional because I know and I love to introduce myself. Having few stories today. Thank you very much, VIDYAPEETH Management, for organizing this. Suresh sir and all the faculty for inviting. So this topic is totally hard, and it took me almost a month to think what should be included, but still I try to do. I'm sorry for this. Can I? Yeah, please. Thanks. Okay, so basically, because you are using your phones, but how many of you know the public health? Can you raise your hand? Raise your hands if you think that you know the public health. Come on. No, but let me tell you, if you are not confident, then we are sailing in the same boat. Because when I got this, I started reading the definition of public health, and then I realized, oh my God, ये तो नहीं पता था. पिछले 6 साल से तो कर रहे हैं. So you know, there is. I don't mind if it's on the backside. Thank you. By the time you just, you want to attach with this? Yeah, that would be fine. So the first thing is public health. And you know what is public health? आप लोगों को definition तो पता है, no, because you are not as. Public health, can anybody tell me the definition of public health? Excellent. Please give a big round of applause for sir. So it is all about talking and promoting the health, preventing illness and longevity. Longevity की बात की जाती है कि हम कैसे लाइफ को इंक्रीज कर सकते हैं. नौ दो गया. That's like okay. लगा दीजिए बस. इसे इसको कनेक्ट करेंगे एक बारी. मैंने ये तो लगाया है. हाँ हाँ ठीक है. You take care. Being the initial slide pretty funny थी. I really some humor for you. So I'm just wishing I can show you my slides. Oh, lovely. Thank you very much. जिसके साथ कनेक्टेड नहीं हो ना, मैं यहीं से ऑपरेट कर. So it is already clear, but the most important is definition has some actions and few stakeholders. How many of you know who's the stakeholder? When we talk about public health, we always talk about that who is directly and indirectly affecting and who are creating that system. So stakeholder is the one who actually getting benefited, for example, society, organization, public and private communities. You must be feeling boring right now, but soon you will be, all that relationship among all. So how many of you have seen Panchayat series? Everyone? So, I do you this and meme to. So this is a very common, like, everybody keep, ye public health hai kya? And then somebody comes and says that, finish. Ask Vinod, samjhe? फिर Vinod के समझ आए. And so it's a very important that first of all, we should know what we are talking. And the most important is to understanding that concept, the base, what is exactly public health. So I really wanted to actually what is public health. How many of you have seen such things? Please raise your hands. Yes. So, this was a Bhaba. I was working in a tribal area in Udaipur, and we have a nurse-led clinics in that rural tribal areas where healthcare access from the government services is much more difficult. So, एक NGO थी, उसका नाम था Basic Healthcare Services. So, उनकी I was working, and then my nurses came and said कि दीदी एक ना patient है और उसका ये सब चल रहा है. They got scared by seeing such dressings. I really don't want to go to the medical stories because you know much better. I really wanted to touch that community story of this part. When I asked them, why you have taken him here? Baba is not well और इतना सारा dressing हो रखा है, ये pipe लगे हुए and all that. He said, madam, बाबा को ना लामा हो गया था, तो हमें लगा हमें लेके आ जाना चाहिए. And doctor was every day asking for a blood. And we are unable to give 500 rupees to the blood bank person. And we are thinking that we should have some money for his funeral also. So, the real, what we are seeing, probably we are just seeing the 30 or 40% of our country. Our country is still huge, canvas. And I request all the youngsters, my budding nurses, please don't stop yourself. Please don't stop yourself to a one place. Love to travel. Go to the places. Explore what is happening. Have you ever heard that coming into your clinic? Her weight is 24. She's having 4 children and her hemoglobin is 1.5. And still, she's saying, मुझे ना सांस फूलता है जब मैं काम करती हूँ. And then he called me and he started crying. He said, Madam, मैंने कभी ऐसे चलता फिरता skeleton नहीं देखा. I'm not really wanted to make you cry, but wanted to talk about AI. But before AI, we have to talk about HI, that is called human intelligence. So unfortunately, we are talking more about the artificial intelligence, but on this artificial intelligence horse, we are losing human intelligence. So this is something to make you, and this is the lovely, I just love this house. I'm fortunate that I visited this house. And my doctor was saying there's a patient who's not coming for the follow-up or he hasn't come to the clinic. I said, why you want him to come to the clinic? He said, he's HIV positive. And they got to know that he's HIV positive because his wife got pregnant. He's Fortunately, both kids are so far not HIV positive, but the wife is HIV positive because of husband, and husband doesn't want to get out of the house. And when I entered into this house, I really fell in love. This is the simplest house. One bakri was there, and there's a cart, ek dibba tha aur ek chula tha. And this place is actually very beautiful and very clean. I feel that life is as simple as they are portraying around them. And then I spoke to that gentleman and he said कि मुझे तो कोई problem नहीं है. Why I should go? And he was right. Sometimes we unnecessarily imposing our diagnosis on the people without understanding their emotions. And therefore, I really wanted to sensitize you what is public health. If you're talking about public health and if you are not लोगों का इमोशंस, लोगों के उनका क्या उनके क्या राय है, उनके परसेप्शन के बिना आप उनके लिए कुछ प्रिपेयर करना चाहते हैं. The topic which is given to me, the rule regulations. Do you think if Vidyapeeth management will be creating rule regulation which will be not in favor of you and you will be feeling यार इसकी तो मुझे जरूरत भी नहीं थी, will you follow that? Yes or no? Yes, because you are obedient students. But let me tell you, in the community, this doesn't happen. Okay? Because community always wants some, they will not do it. So as our nursing student keep going in the community, believe me, whatever you tell, 5 minutes, 10 minutes, 15 minutes, that doesn't stay with them. Because community means staying with them, understanding their challenges, understanding their cultural behavior. Please connect with them before correcting with them. So unfortunately, we as a healthcare professional, we go and correct them and we have no connection with them. And that's most important. So other challenges which we usually forget when we are giving some basic healthcare advice to our patients, like TB ke liye, we are giving so ask them that how they have come from their home to the clinic. For them, it is a very difficult. For a place where I used to work, it takes 3 visits to diagnose a patient TB. And then ultimately, by the time patient diagnosed the TB, he decided not to come because he's already out of money now. He said, like, मेरा 3 type का visit में पूरा पैसा जा चुका है. So, until unless you don't understand the social determinant of health, you cannot understand the public health. And if you can't understand the public health, how you can bring artificial intelligence into the public health? Because artificial intelligence definitely amplify the system. But for that, you need to understand that first. And therefore, I know you can't go there. But fortunately, we can bring stories for you all. And I know you would love these stories and read more stories from your AI mobiles. Because now you are just away from a click. If you really want to learn more, you can get it. So I am just giving you a sensitization picture from my experience. So if I'll say public health, so this whole institution is itself an example. Somebody thought that education should evolve in this area, and they have come up with this teamed university. I always says, and you will be seeing my slides, that they are also made from ChatGPT. But let me tell you, I rule AI. I give them a strict instruction. This article, this document, this, I want everything from this, and this has to be from this para. Because I have read all these documents, I have read all that background. So the most important and the beautiful part of the AI actually is your best friend. If you give them a right direction, right hint, they will come up very productive, crisp content for you. So I'm sorry, I'm going off track, because when I see students, I feel that you guys are very fortunate, because when I was doing nursing 2 decades ago, we don't get these type of I would say कि हमें कभी इस तरह के chances मिले ही नहीं कि we are sitting in a conference hall and somebody is coming and talking. I know it's a boring, but fortunate bhi hai, you get something new out of your routine. So recently I got this and I really liked it, that it was saying that when student is ready, teachers appear. So it is not teacher's responsibility. That teacher is always responsible for creating the student future. It's high time that students should start deciding their future, and then you will see the teacher is automatically appear to guide you. So earlier we used to say, oh, teacher अच्छा नहीं है इसलिए student अच्छे नहीं है. But आजकल के students इतने smart हैं कि they can make everybody smarter than them. So I request every student, if you feel that you really wanted to evolve as a better personality, a better human being, or a better professional, please invest on yourself. And the moment you start investing and start, एक यूरोप में बोला जाता है, adult until unless they are having urge to learn. So it's very important that you have to ignite your urge. Only then you will extract what your teachers all have. Unfortunately, in India, we are more talking about the degrees than the skills. Because everybody's waiting. Mere 4 saal complete hoye, I'll get the degree, I'll get a job, and then I'll go to the north side, and then maybe few people are planning to go abroad. But this will make you a person who can obtain a job. Believe me, after 20 years, you will be on the same job, not doing anything, and you are saying, nursing mein kuch nahi ho sakta. Because for that, you need to acquire skills. You need to be out of your comfort zone. You need to be part of such activity. You need to be out of your own liking and disliking, and actually learning the health. Trying to, I keep on saying to my friends that you can buy a expensive sari, you can spend lots of money on the Pizza Hut. Why you can go and take a course, a simple course. Just before us, ma'am was saying that she has done almost 3 courses from Coursera. So, this is, and sitting at that place, and still she is developing herself. And that's what I want from you all, my dear students, because now policy, everything is in your hand. You are our future. If our future will not invest on themselves, then we will be in great difficulties. And last but not the least is, during this period, you have to work a lot on your mindset. Let me tell you, even the policymaker, even the community, nothing work if they are in closed mindset. And this closed mindset always keeping you low standard. So the best thing is that see who you are, how much you are adaptable to the new things, how much you are resilient to the things which is not happening as per your requirement, and then you are creating yourself a better human being, professional. Unfortunately, in nursing, we are not working in our mindset, and therefore we are seeing we are not evolving much. So, when I was thinking of AI, so I was just thinking that, yay, this is the first, what is that? Yes. Before this, it was invasive procedure. To check the BP, it has to go to the vein and then they measure the, that pressure. So from the invasive, this was first non-invasive BP apparatus, sphygmomanometer, and now it reached to this level. From 2 to 5 minutes to now less than 30 seconds. But do you think this is enough? Because, more important is transformation तो हो गया है, translation नहीं हो पा रहा है. How many of know in a government hospital, and you know what happening when we go to the rural and tribal area, we are seeing that people are not checking the BP itself. And despite having the best of simplest equipment, if you are not checking BP, or if you are checking BP, you don't know what to do next, is simply useless. So therefore, I keep on saying AI has to be strengthened, but HI need to be over strengthened. You have to develop so many skills actually to use AI. And then it comes to AI definition. I was so impressed with this definition because I found this is the definition which I always follow. It stimulates human learning, comprehension, problem solving, decision making, creativity, and autonomy. Let me tell you, friends, if you understand things, then definitely you can solve the problem, you can make a decision, and you will be creative. And ultimately, when you are having all this quality, there is nothing like autonomy. Autonomy will automatically come to you. If a person can take his own life decision, so that person, everybody love to give that authority to them to take the decision of your life. Sometimes you say कि मेरे parents ये बात सुनते ही नहीं है, because let me tell you, your parents can't trust you. जो time पे उठ नहीं पाता खुद, उसे क्या expect करेंगे, है ना? तो it's always important to actually show that you can do it. The moment you start showing to the world, the nurses, they can show their leadership skills. And I was very impressed with the last presentation. And before then, that ma'am was talking about that how we can use AI. Nurses are actually, I would say, presenting in the external environment beyond nursing, that is much needed. And the most important term which I like nowadays, and whenever I am designing my workshops and things, I keep on saying comprehension. This one-way learning, I know how, because I'm just lecturing. So this speech is help you to gain something like a 5%, and you will be retaining less than 1. We start talking discussion. So this discussion actually retain 50%, and this should be the classroom model. Unfortunately, our students don't understand the importance of group discussions. So the moment teacher says group discussion, so we start chit-chatting. So guys, I really wanted you make sensitize. Your future in your hand. Wherever you want to go, you have to start from here only, and then only path will go up on the top. So I hope all will be agree with me. Is it? Have you seen this movie? Agree? तो कितने बंदे काबिल होने के लिए पढ़ रहे हैं? And then come back to the public health. So public health, looks like this. For somebody, it is like triangle. For somebody, it is square. For somebody, it is square, round. So, it is a perception. Why I was saying that we have to be open-minded, because only then we can understand everybody's perception, and then we can create a system. If you can create a system, only then you can use that technology and amplify that. Otherwise, we usually like that. We have our closed eyes, we are seeing something and we are saying, ye to yahi hai. How many of you have seen this picture before? Raise your hands. Yes. So basically, this is all that blinded, folded person asking to touch an elephant and they are touching that elephant and feeling, oh, it's a wall, it's a rope, or is she saying, oh, it's snake? So until unless you will work on your mindset, you will not grow. And then it comes to public health current challenges. I can speak all these things because from last 6 years, from my corporate journey to the public health, I've seen these things and things are actually, I would say, in a raw and crude form. So we know these 3A, everybody know it. Access, availability, and affordability, we have to work on it. But what are the major challenges which I found in my last 6 years experiential journey is sometimes, PSC is there, hospitals are there. Even we have worked with the many big states where we are working with the policies and we do write policies for emergency and trauma care, how we can improve that. So one thing which we realize that despite having the services, people don't access those services. Can somebody tell me the reason? What is a major reason that people are not accessing services despite having the services? Quality of service is not good. Very good. Yes, sir. Yes, the perception people are sometimes they feel that, oh, these services would not be available. Anything else? Lack of knowledge. They are not aware that these services are there. Excellent. Yes. Yes, रॉन्ग ट्रीटमेंट कई बार होता है ना, पहले कोई एक्सपायर हो जाता है तो उस हॉस्पिटल में वो उस पूरी कम्युनिटी के लोग जाना ही बंद कर देते हैं. एनीथिंग एल्स? डिफिकल्टी इन ट्रांसपोर्टेशन. यस मैम. मिसअंडरस्टैंडिंग. यस. Easy access to private. Yes. And one more thing which I came across with my personal experience, somewhere when we are talking about the rural area, private and quacks are more friendly to the community than actually professionals. So, professionals usually having some distance. They feel like ye community aisi hai. They are illiterate people. Whereas that the local doctor, who's a private doctor, so-called private doctor, and sometimes a quack also, even the private doctor, they treat community very nicely and that's made them most trustworthy. So the one thing which we found that trust, sometimes even district hospital, people are not going to the district hospital and they prefer to go to the local doctor who's not having even degree. So trust is a major important to which abstract from the access of the care apart from not having the infrastructure. Second is availability, the quality services, and last but not the least is the affordability. And I really wanted, always I want my students and we nurses should talk about data, not only emotional stories. Because yes, I'm talking about the emotional stories, that's anecdotes, but this is all relevant and evidence-based, and I am backing up with the data. So this data says 35 lakh people die every year globally because not having access to healthcare. And can you imagine 50 lakh people dying globally every year because of poor quality of care? And let me tell you, when it's about quality, so nurses are the major backbone of quality healthcare system. And we can actually prove ourselves and take this accountability. We can tell that government that, look, don't worry about quality. I will lead. Basharte, we have to portray ourselves. We have to take that responsibility and accountability. It is actually a dirty job to become accountable for something and you have to risk yourself. But let me tell you, we are the only one who can improve Indian healthcare system by taking the lead in the quality. And this can help a lot. So I keep on saying, if you don't go hospital, so there is a 20 to 35% chances that you will be survived because you will be not dying because 50 lakh people dying because of poor quality of care. Now come to the direct point, that policy and regulation. So Niti Aayog already made a very nice strategic document on artificial intelligence and they have written beautiful about healthcare. And then ICMR talked about ethical guidelines for application of artificial intelligence in biomedical research and healthcare. So here I just wanted to add few more things in your knowledge, how the policy, how the regulation formed. Before policy and regulation, there is a one thing which is called the strategic document. This is all about the planning. That experienced person from all over the country and the region, they sit together, they talk on that topic, and they make some document, and that is usually called the strategic document and action plan. And based on that action plan, then the small models evolved, that is called piloting, and ultimately then rule regulation, and then in a later stage, policy formed. So this is from this Niti Aayog report, that accessibility of healthcare across the India. And this is very beautifully, they are showing that what is the current accessibility and how AI can amplify that accessibility. So if somebody is interested, they may go to this, and page number 24 onwards, you may read about health and policy regulation. It's not policy regulation, it is a strategic document. So they compile that all data, and how artificial intelligence can improve that, that is clearly written over there. So by the end of my session, I would like to say that AI will definitely facilitate our life, but we should not underestimate human intelligence, because if you underestimate human intelligence, then you will be overpowered by AI, and that become very mechanical, and that will not help our healthcare system. So when we talk about that policy, that how policy should look like, policy should have a privacy, security, data integrity, and a very important, which earlier speakers also talk about, that compassion and empathy. Policy should be very simplified version where people love to opt it. For an example, when I was reading about it, I got to know that how public policy, earlier, if you see something 40 years ago, a leaflet of anything eatable, they don't mention the calorie. But suddenly 3-4 decades ago, there is a research started coming up that, obesity is a major cause of the NCD. And NCD is taking toll of the lives. And ultimately, that all country, WHO started talking about that calorie measurement has to be in all eatables. And that is how we are seeing calorie on every, whatever you are eating, biscuits, you are eating chocolate, even anything, you can see the calories. So this is called that how policy evolve and disseminate. The most important, policy should go to the people in their own language. Only then this used properly. So I would say AI facilitates, support, improve efficiency, productivity, but cannot replace human intelligence. And this is AI. AI is basically a belagam ghoda, jisko HI chahiye, so that we can use it optimally, and productivity and efficiency can be improved with human intelligence. With that, I'm ending my session and just wanted to give little more gyan. Be happy always. Avoid these 3 C's. Compare, compete, and complain, because you are so special, you are so unique. Always strengthen your uniqueness and your, I would say, you yourself is special. But sometimes we are just seeing ourselves, comparing other and finding. It's just like Apple is saying, oh, why I can't look like mango. So I find that steal our peace, happiness, and confidence by these 3 C's. So it should be away from our lifestyle. And last but not the least, you can have these slides if you feel that it is useful. Though I'd never make some useful slides, but it is all yours, because I don't believe in what is that called? Patent, intellectual property, because whatever the property, intellectual property I have, it is from collaborative approach. So I learn from everyone and make something out of it. And then we all do chat GPT. एक second. Yeah. So yes. Don't worry. I'm going to give this because this is my commitment to all. Just a moment. Yeah. And this is for... Sir, ek bari laga dijiye. I'm more than happy if anybody want to have any query, questions. सही वाला slide वाला लगा. Yes. Yes, this is. Any question, any queries? That's all from my side. Thank you very much.
Excuse me, ma'am. Yeah, ma'am, I had one of the question which I need to answer as an extension of what you have mentioned, and from the right from the yesterday sessions. That is regarding it saves time, it improves efficiency in short time, and all the like many material can be saved through use of AI. But I just want your opinion or your viewpoint upon like when we use when we save these all man, money, material, and time, what would we do with that saved time? Are we able to handle it judiciously for the welfare of community or patients?
A very intelligent, I must say, and very nice question. And therefore, please give a big round of applause. Because what he said is extension of my talk. Why I keep on talking human intelligence, human intelligence? Because if you are humanly intelligent, only you can think about the humanity. Let me tell you, if you can see that slide, just why people are not going to these places, rural places, because they are not finding it very charming and fancy. But people still need healthcare, and healthcare professionals are needed there. So what we will be doing out of that saved money, efficiency, people, energy, that we should start thinking, can we contribute our 1 month or 2 months to these areas? Believe me, when you start working in these areas, you will be addicted to work with them. They people are amazing. And as a nurse, I really wanted to tell many of you who is already in a settled position now. And our bachas are more settled because one thing I always agree that if you're working in rural and tribal area, the education system is compromised because they are not having good education system. And everybody want good education for their next generation. So once we settle, can we, if we are saving our time, can we donate this time to somewhere else? As a couple of years ago, we were listening, probably it was a Sweden model, that they are asking their citizens contribute few hours to taking care of elderlies. So it is high time that we should talk about that. So if we will be saving our time from this advanced technology, artificial intelligence, we should use this time productively. Otherwise, we will be actually sitting on a time bomb. If you will be misusing your time energy, so you will be seeing that in next generation and upcoming years, we will be actually having less intelligence and more mechanical things. So I totally agree with him that once we will save everything, we should be spreading it in an equitable manner and putting more things to places where it is not there. I hope I answered your question.
Yes, ma'am. Exactly. Exactly.
And for that, we genuinely need humanity and human intelligence.
Thank you, ma'am. As if we reach with a horse with control of AI, if we reach early, what we are going to do there? That is the matter, and you answered it aptly, ma'am. Thank you.
With AI, we can reach to every place. But only AI doesn't work. Because those people, AI will be, अगर आपके city में, Mumbai में एक hospital में AI robotic nurse होगी, तो they will be happy. But in a गांव, they will not be happy. So I really want that we should reach to those places where we are needed genuinely. Thank you very much.
Let's recognize what is the real public health nursing in rural, hilly, and community areas. Madam has highlighted on challenges while working in the hilly and tribal areas also. Thank you for letting us know the policy and regulations also. Madam, you have imparted a great knowledge within us. Your session has been truly enlightening, and thank you for imparting knowledge, giving us your valuable time, and we'll carry the wisdom you have imparted with us for a lifelong time. Thank you very much.
Thank you, Shilpa ma'am, for concluding the session. I also request you to felicitate Dr. Rupa Rawat ma'am. To formally acknowledge the moderator's contribution, I invite Ms. Jessica Mari, Faculty of Nursing, to kindly come forward for the felicitation. Our next session addressing nursing workflow automation, a rapidly emerging field influencing efficiency and clinical precision. We welcome Dr. Jasneet Kaur, Professor, Symbiosis International Deemed University, Pune. I request Mr. Vishal Ghorpade, Faculty of Nursing, session moderator, to open the session with the speaker introduction. Delegates who are having issue regarding conference fee receipts, kindly meet Dr. Baswan Dudum sir and team registration and certification committee.
Thank you, Nikhil sir. Good morning, all the respected dignitaries, invited speakers, and faculty members, and all the delegates present here. I, Mr. Vishal Ghorpade, Assistant Professor, Bharati Vidyapeeth College of Nursing, Sangli. I feel great honored and privileged to moderate this session. The topic is nursing workflow and automation. So definitely this topic has a transforming the future of clinical practice, quality care, and efficient healthcare delivery. Today's speaker is distinguished academician, researcher, national figure in nursing education and healthcare innovations, Dr. Jasneet Kaur, Professor, Symbiosis College of Nursing, Symbiosis International University, Pune. Dr. Jasneet Kaur brings with her an exceptional 21 years of experience with expertise in community health nursing, nursing informatics, quality assurance, research methodology, and academic leadership. And also she holds a PhD, MSc Nursing, and postgraduate in Diploma in Hospital and Administration, and Master degree in Health Education and Administration. And she has completed prestigious certifications from the University of Minnesota, Johns Hopkins University, IAP, IIT Madras, and INC. Her research credentials are truly remarkable. She has 108 publications, including Scoopers, Web of Science, Q1 and Q2, and she has 8 book publications, and also she has recognized PhD and PG guides, and she is numerous funded research projects and patent holders of Community Health Nursing Care Bag. This is a special one. So reviewer of international journals, including Taylor and Francis and Doe Medical Press, that is Digital Health USA. So she has also recipient of prestigious awards such as Best Nurse Researcher, that is TNI 2425, and International Best Leading Professor Awards. She also presented in India internationally, including Italy, Japan, Oman, and she served in multiple national committees, including INC, QCI, and NAC, and various universities bodies. With such a rich professional journey, she stands as a powerful voice in advancing the integration of technology and AI into nursing practice. Ladies and gentlemen, please join me in welcoming highly accomplished and inspiring speakers, Dr. Jasneet Kaur, to deliver her session, Nursing Workflow and Automation. Ma'am, the stage is yours.
Good afternoon, everyone. So, my fellow colleague, Rupa Madam, she mentioned one word, that AI and HI. HI will going to superimpose AI. Very true. AI cannot work until HI is there. If you do, AI will definitely will be out of control if HI will not take care. So, in consensus with that, my today's topic, what I'm going to discuss with you, that is nursing workflow automation. We're going to automate certain work for the time which sir has asked, but not to take care of our jobs. Okay. Recently, before starting my topic, I just want to share one incident that recently in 6 months back, there was a big news in the Tribune that AI will going to eat healthcare jobs. It was a big discussion when AI has boomed up. So a lot of healthcare professionals, they were in a dilemma that what will happen? Are we going out of the jobs, as IT people are already getting out of the job because of the AI? So the answer was big no, big no. The answer was big no, which madam has already answered, because AI requires HI. Human brains are the major requirement to proceed with AI. Okay. But the point is how intellectually we have to use that. How beautifully we can use it to save our energy, save our time, save our, outputs, and to have a better efficiency and better outcomes. Okay, so let's just have a quick understanding of the workflow in nursing. We are doing the routine and critical tasks throughout the patient care. That is a routine task. It's time consuming. These are hectic, heavy workload. Nurse-patient ratio, specifically talking about Indian scenario, is very, there's a large gap. Okay. And administrative duties, of course, we cannot deny. So this is the routine work of a nurse. Okay. It is not only patient care, it is administrative tasks also and other duties. So why automation is required? Something should be there to help us out. Something should be there to, keep our burnouts away from us. That is where AI plays the role. AI, what they will help, I'll discuss one by one in later slides, but what exactly we need to do? Okay, the point is workforce shortage impact quality and safety. When one nurse is going to look after 10 or 20, that is, I'm talking about very less actually. In certain scenarios, it's 50 patients. Obviously, the quality we cannot expect. Still, we are, managing some or other way. The quality is actually hampered. So how AI can help into that? Let's understand what is workflow automation. It is the use of any software or any AI tools or any things which are working backhand to handle our task. That is what actually nursing workflow automation is. Okay, I hope many of you are students, so you are also taking certain helps of AI tools to finish your assignments, keeping your brains right now non-working. Okay, so this is what nurses AI workflow, but it is actually not. When AI is working, including nurses' brains are also working, that is where we are calling it nursing AI workflow automation. Okay, so components are, let's a small component like digital documentation system. Everyone knows EHR and EMR, electronic health records, digital documentation. These are certain examples. Provide instant alerts and patient updates to the right nurse, preventing the mismatch. Okay, so when you are having AI tools with you, it will give you a backup store which your brain is backupping for you, right? So if you have digital kind of environment and digital kind of scenario with you, so the work will be 50%. You need not to remember patient's name. You need not to remember, of course, you need to remember patient name. You need not to remember the details or certain things to mug up. You can use the digital transcriptions, digital methods to, get that information instantly. Okay, medical robotics. As ma'am said, we will be discussing medical robotics are not like robots are there and they will replace the nurses. It is not like that. It is not like that. Certainly, it is not like that. Medical robotics are there to perform the delivery of the task under the guidance. Okay, in a very layman language. Very, very layman language example. Nurses are having a lot of back pain. To lift an orthopedic patient, robots are required. You understand? You understand? This is a simple example where nurses require AI. It is not like a nurse is sitting and AI is doing everything. It is not like that, right? Real-time monitoring system. Yes, you can track the vital signs. Now, this real-time monitoring system is already available in many hospitals. Okay, digital input devices are there where exactly what at present real time is actually what is lively going on, that you will come to know. Okay, that is called real time monitoring system. These are certain words which many of you are aware, many of you are not aware. Okay, so that's why I'm using this terminology in between, right? Then predictive analytics software, very, very important. Now, what these softwares are doing, they are predicting certain things. Like, for example, history of the patient is recorded into the system, EHR records are there, and present condition under the real-time monitoring system is there. Now, whether the patient will be going to have certain disease or not, that is called predictive analysis. You're predicting based on the past history and based on the algorithm. How weather department, they are forecasting the weather. How? Based on the predictive analysis, based on the algorithms which AI is using. Okay, so that kind of facilities is very, very important. And under that, if we'll have that kind of facility, we can definitely give a very best quality of the care. Now, what are the types of automation tools? Okay, one is clinical automation. Clinical automation tools which basically we are using for the delivery of the task, delivering the medication, okay, monitoring and diagnostic. Okay, these are the clinical tools which we are certainly required for clinical components, right? Another tool is administrative tool. Now, where nurses are, aap idhar aa jao, aap udhar aa jao, wo chodo, ye kaam karo, this, that, anecdote records banao, etc., etc., etc. For that, automation tools are required. Okay, so for that, administrative automation tools which supports your scheduling, your inventory, your day-to-day routines, your supply, everything they can easily manage. Automated documentation. Now, we are writing long notes. Famous nurses are famous for that, writing long notes, long headings with twisting headings and twisting handwriting. Doctors use their brains, what it is written. Even sometimes I am also eating my own brain, what I have written. Okay, it happens. It's very, very common because it's a tedious task to write the notes for 50 patients at one point of time. There is a facility, voice-based chatting. Now, there is a facility under AI, voice-based chatting, where you can record your notes. You can speak. Your speech will automatically convert it into text. And it will automatically save under the particular patient name under digital system. Okay, so it will save time, right? Then auto-populated EHR templates. Now, EHR templates are auto-populated. I mean, EHR, it is already available in many hospitals. Okay, so electronic health records are already there. Then AI-based smart prompts. What are prompts? Can anyone tell me what are prompts? Anyone? Those who are using ChatGPT, they must be knowing. Prompts. Thank you, Kulkarni sir. Yes, these are certain, we can say that orders. We are throwing certain messages, words or orders under which a long story will come. Okay, these are prompts. You people are not using ChatGPT. Very sincere students you are. Okay. So the AI prompts in clinical setting are those when you are giving certain prompts to get info, right? For example, a quick example. I want to know how many diabetic patients are there right now at my hospital. Okay, a prompt is diabetes, today's date, from date to this date, list. These are certain prompts. It will give huge list. Whatever the diabetic patients are available at your hospital today, they will give you the list. This is called prompts. So there are certain prompts which are automated, certain which manually you have to put. Okay. So what is the benefit of this automated system? One is it saves time. It saves time. Madam has also emphasized upon it saves time. Reduce the subjective or incomplete records. Okay. While thinking, we are thinking 10 lines. While speaking, we are telling 8 lines. And while writing, we will write 4 lines. Okay. So it saves errors. So complete records we will get and ensure continuity of the care, because who has done what last, I have to follow up and give it to the next. Complete records, and it will fetch who has done what task, because it is entered automatically. Manual errors and manual changes are not allowed. Okay. One important is medication workflow automation. Okay, we are following 5 hours in the medication. I'll come up to that also. Okay. So one is barcode medication administration system. Okay, BCMA. So now how AI they are working? They are putting up the bands on a patient. When the patient is getting admitted under EHR system, their details will be entered. They will generate a barcode per patient. So that barcode will be on the hand of the patient. And in that, it is actually synchronized with the prescriptions and medications at the time when whatever the doctors have prescribed. So just to scan the barcode, you will come to know this patient is due with this medicine, or this patient is going to get this medicine. Okay. So this is called BMCA. Okay. Scan the patient IDs and immediately you will get the details that what are the medicines required and what is due right now. Okay. That barcode is actually synchronized with the digital EHR system. Okay. Another one is the smart IV infusion pumps. Earlier, we used to see, and for the infusion pumps, how we need to set the dose, we need to see how much is left, how much is there, what is the pressure, everything. Now, digital smart IV infusion pumps are there where doses are inbuilt, they are calculating inbuilt in that system. Okay, you need not to worry. Automatically, when it will be finished, it will give the beep. Okay, so this is all AI system. Now, here, it is not replacing nurses. Nurses has to fix AI. Nurses has to fix the IV infusion pump. Nurses has to scan the barcode. Who is going to scan the barcode? HI, human brains, right? Next, automated dispensing cabinets. These are mostly available in the foreign countries, automated dispensing cabinets, where they will track the access of the medication and then they will deliver correctly to that particular place. So automated dispensing cabinets are also there. In that, few cabinets are there where the barcodes are there. Few cabinets are there which are connected to the synced to the digital monitoring system. Okay. Next, we have electronic verification alerts. Suppose you are giving a wrong medication to a patient, it will give beep. that warning signal that something is wrong. Or in the history, when the patient has got admission, in the history it was written that patient is allergic to such and such component. But you are administering the medicine right now, which is allergic. So it will give the beep. Okay. So what it will do, it will help to prevent the errors. Okay. So what is the impact on the medication safety? 5 hours, everyone knows. 5 hours, everyone knows. So it will help to reduce the error in the 5 hours. Okay, right time, right medication, right road, dose, time and patient. So because system will automatically check it. System will automatically trace it. After that barcode, system will trace it. And automatic cabinet machines, they will give you the right medicine to the right patient at right time. Warning is also there. If something is going to happen, warning is also there. Okay. Then it provides real-time alerts before the harm occurs. You have administered a wrong medication to a patient, and later on you will realize that I have given the wrong medication. Instead, AI will give you the beep warning signal that yes, you have done something wrong, don't do it. So it will help you to prevent the harm before the actual occurrence. Okay? Then it improves the accountability and record accuracy. Tune kiya, maine kiya, it will not going to happen because everything is going to record digitally into the system. Whose turn is there, it will be recorded. Who has opened the barcode, it will be recorded. With whose cabinet the medication has been gone, that is also recorded. So it will record everything, right? Next is, there are certain AI devices which are, this is for the nurses what we are talking about. There are certain devices which are there for the patients, okay, which will help us to do the things. Now everyone having smartwatch, there you can see your heartbeat and your pulse rate and everything, right? There are few smart devices like wearable ECG and oxygen sensors, which patient can wear. With there you can have a real time monitoring that what is the level of what is called SpO2 on the oxygen level, what are the ECG readings. So there are smart wearable devices which are nowadays, it has invented. Then bed movement and fall sensor, that is very important invention, specifically for the night nurses. Okay, patient will have that sensors on the bed, right? Even on the body, maybe on a nearby knee or maybe nearby shoulder, you can place the sensor. Even the patient will move, okay, it will give the senses, beep, that patient has taken the turn. And if the patient is going to fall, that will going to give the beep that patient is about to fall now. Okay, so specifically for the night nurses, they will not go to bed and check whether the position is correct or they are going to fall or something like that. So these kind of wearable sensor devices are there for the patient, which helps the nurses to protect the patient and prevent the harm. Then AI-based deuteration prediction. Okay, so these AI tools actually helps in predicting the further deuteration. You cannot check your sugar level every 10 minutes, but there are sensor devices, those who are having logs, which will give you the information throughout the day, 24 hours. So it will give you a better prediction whether any deuteration is going to happen or not. Okay. Next, so what is the advantages of this smart monitoring? Obviously, it reduced unnecessarily manual vital rounds. Every 2 hourly BP apparatus uthaya, BP check kar rahe hain. All these things will be, avoided. It saves times, okay, and energy always. It prioritizes high-risk patients. See where the beeps are coming. High-risk patient will be prioritized. Then it creates a consistent data stream. Next is, now we have discussed about the nurses, one we have discussed the patients. Now we will be discussing about the automatic system available for the tasks. Okay, so one is digital task boards, assign nurse activities. So this is a task board actually, you can prepare digitally with different color codes. And this is a to-do list for today's. Okay, so it will automatically fetch up that this is due today. What will happen? It prevents your handing over. So while handing over, what you will do, This we are giving the over to the next round staff that these are things are due for this patient. You have to do this, you have to do this. But rather than that, this digital task board will help you to understand what they have done and what is due. There is no need to give the rounds also. There is no need to give the handing over also, because the tasks are automatically, pumping up on the task board. Okay, so this is to-do list. This you can do. Next is mobile reminders to reduce the missed care. Mobile reminders. It's a time, beep time to do the exercise. It's a beep time to give the nutrition. It's a beep time to give the medication. So automated messages will be popping up on the dashboard, and it will give you the clue that now the medication is due for this patient. Like that, kind of like how we are getting the messages on the phone. Similarly, the messages will going to pop up into the digital dashboards. Then automatic updates when patient condition changes. This is earlier we have in our ICUs, when any patient's condition is changing, the beeps are coming up. But here in the dashboard also, all patients are, patient data is synced with the centralized dashboard. And if the patient vitals are changing, you will come to know, okay? Then communication automation, app-based nurse messaging. I want to give the message to the night staff that you do this, app-based. So I will drop a message in the app. Everyone will come to know that I have given a message to this nurse that to do certain things in the night duty. App-based messages, which is very, very common. Now we are also using, schools are also using app-based messages. Okay. So shift handover summary is auto-generated. Whatever you have done, your shift, whatever you have done, your summary will be auto-generated by the dashboards. Now, those who have used the Microsoft Teams or Zooms, you have seen that whatever you're talking, it will automatically transcribe and it will give you the summary at the end. Okay, have you seen? Have you seen? How many of you have seen the Zoom calls and Microsoft Teams? I think IT people, you can vouch for that, right? So automatically whatever you're talking, it will automatically create a summary. Similarly, whatever the activities you are doing, nurses are doing, okay, the day activity, it will conclude up to the summary of that particular thing, right? And now another aspect is supply chain management. One important thing, very, very important for the nurses, which I'm damn sure every nurse wants, where we have kept the things, where I have kept the suturing material, where I have kept this particular inventory. Let me find out. Let me see. This is the solution, RFID. Okay, that is actually infrared rays kind of, signals. Okay, tags are placed to every inventory. Okay, and it is connected to the centralized mobile or maybe computer device. So you will track which instrument is placed in which cupboard. This is RFID system. Tags are there. Whenever the inventory will come, tags will be placed. Okay, you keep wherever you want. Done. Now, at the time when you require that particular instrument, you need not to search. Just sense it with the mobile operation. It will fetch where the instrument is. Okay. Okay, so auto inventory, and yes, now next is robotic carts. Robots are not only there to help you at the patient bedside, it is for the carts also to supply the medications from one point to another point. Okay, then outcome in the resource management. Obviously, it reduces the material waste, consistent availability of the essential supplies all the time. Next is robotics in nursing. One is delivery robots. Delivery robots will do you to deliver your task. Okay. To deliver your task, like you want to give the medication to this particular bed, robots will take. Okay. You want to give the food to this particular bed, robots will take. Another kind of robots are UV disinfection robots. You will disinfect the OT with this UV robots. Okay. Then third kind of robots are lifting devices that I've already explained. Okay, lifting robot. So there are types of robots. It is not robots will going to replace the nurses. Okay. Next, clinical decision support. Very, 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 very important. In clinical decision support system. Now this AI tools, predictive analysis we have discussed. Prediction is there. So it will help to take you the decision at right time, that whether we should go in this way or in that way, right? When you are into the dilemmatic situation. It suggests the solution based on the standardized protocols. It is not going to give you any guess. Because the standardized protocols are already entered into that, it will run the algorithm and it will give you the decision based on the protocols, right? Then staffing pattern also you can manage, night duty staff, morning duty staff, how many staffs are there, how to rotate through these AI tools. Okay, now what is the benefit to the hospital and patients? In conclusion, higher safety and quality of care, very good experience of the patients, and operational efficiencies will be increased as far as hospital and patients are concerned. So but there are barriers to adoption. As the mindset is there that AI will going to replace the nurses or AI will going to replace the healthcare system or healthcare personals, it is wrong. So there are barriers. Barriers are not only the mindset, as in terms of finance also we are thinking as a barrier. One is cost. To generate the AI system, you need money. Okay, you need to purchase it. So cost is the biggest barrier. Those who are into the positive mindset, they will take, otherwise they will not take. Then skill gap. At present, if I'm talking about myself, I am not ready for the AI because I am not well versed into that. I do not know how to operate AI tools. I do not know how to operate robotics. I do not know how to operate the digital system. So skill and training is a barrier which is definitely we can overcome, but it requires lot of training. Okay. And system compatibility problems. Cybersecurity concerns are very, very important, particularly in MIS, those hospitals which are running HIS system. So cybersecurity is a crux, particularly in the medical legal cases, because these all are software-based systems and breaching of the software is easy for the hackers. Then solutions, continuous training is required. You go with the pilot testing first, then run a full show. And interdepartmental collaboration, only nurses cannot do. You need IT people, you need trainers, you need, management people to ensure those things. Ethical considerations. Now, where AI comes, who will take the onus if something wrong happens? Either nurse or doctor or the company or that machine. Who will take the onus? Who has done the wrong? So there's even ICMR, I think they are not having a standard guidelines for the ethics pertaining to AI, where the AI is involved. They are still under revisions. A lot of legal and, legal policies they're working on it, but still they have not come up with the final draft of the AI when involved in the healthcare, where the ethics play the role. So still the version is under the drafting stage. Okay. But however, protecting patient privacy and data rights, what will happen if cybersecurity breach is there? Question. What will happen if maintaining human interaction and empathy? Where is the empathy in robots? That is another ethical question. Avoiding unequal access to care. We are prioritizing to the priority people. What about others? There are so many ethical questions which are unanswered as of now, but for sure, healthcare 5.0 era will definitely get the answers. Okay, so this implementation, if we can do smart bed monitoring, BCMA monitoring, it will help you to reduce your manpower cost to 50% if you will do. Okay, future of automation. Today we are talking about AI, tomorrow don't know which kind of I will be there. It's A, B, C, I, whatever I can be generated, right? So virtual nursing assistants for remote rounds. Public health, madam was talking about in the rural area that public health, when we are public health personals, rural people, they do not want care from the robots. But we do not know tomorrow. More than robots, something else will be there, right? It will come. Virtual nursing assistants are there. Automated medication delivery systems are there through drones and robots. We have seen drones only in the TV. Actually, drones we have never operated. So tomorrow we do not know what kind of skills we require to even play the drones also. Okay. So gestures and voice controlling chatting. So these are the future of automation. augmented reality, digital twins. I think these topics are already covered by few of your speakers. So digital tools are available. Those who are using the chat GPT, please use it positively to understand what are the tools of AI which are required, and competencies, of course, nurses require. At present, nurses are not competent to run AI tools. At present, 95% nurses are not competent to run the AI tools, even in the JCI and NABH accredited hospitals. Okay. So what is the take-home message? Automation will improve the workflow, not replacing the nurses. We are here. We are HIs. We are not AI, we are HI, and we have the power to operate the AI. But we have to learn first, right? Nurses' participation determines the success. Let me see how much I can operate AI. That will depend, and my success will depend on that. And last, balanced approach. Okay, you have to use robots, but you have to show empathy also. Okay, that's it. That's all about my topic. Thank you so much. I have given you a quick glance of AI automation workflow. So open to you all.
Yes, audience, any questions? Yes, any questions related to this session? Yes. Ma'am, I'll ask one question.
Please.
Which area of nursing workflow shows the highest potential for the automation?
Which area?
Specific area.
I've given you example. You are a man, you have enough stamina to lift the patient. Ask the female nurses, they will give you the answer. I think medication and shifting the patient is the base area where female nurses are facing the problem, right? So if AI plays role there, that would be far better.
Exactly.
Far better.
Yes. Thank you very much, ma'am. Thank you, Dr. Jasneet Kaur, for such an enriching and insightful session. Yes.
Nowadays, machines are in between us, so we are departing each others. So better to have, as per my opinion, both should be come together to patient, machine.
Very true, sir. Very true. See, we cannot totally depend on AI. We cannot, specifically talking about nursing aspect, we cannot totally depend on AI. However, AI can be our assistants to fulfill the task in less time, but it is not superimposing the nursing task as such completely. Very true.
Thank you very much, Dr. Jasneet Kaur, for such an enriching and insightful session. Your presentation on nursing workflow and automation has truly illuminated how technology, artificial intelligence, and digital innovation can transform everyday's responsibility of our nurses. Today, you have highlighted several key aspects. The key aspects takeaway message from this session. Automation, nursing workflow automation is not about replacing the nurses. Yes, enhancing precision, reducing workload, and improving the patient outcomes. Ultimately, automation has strengthened the nursing workforce, allowing more time for compassion and patient-centered care. Yes, your session has helped us understanding the future of nursing is collaborative, where human expertise is supposed to buy an intelligent system to achieve the excellence in care. On behalf of organizing committee and all the participants here, I extend heartfelt gratitude to you, ma'am, for sharing your expertise, experience, and various visions with us. So, ladies and gentlemen, please join me once again for giving a big round of applause for Dr. Jasneet Kaur. Thank you, ma'am.
Thank you, Vishal sir, for concluding the session with such clarity. I now request you to please come forward and felicitate Dr. Jasneet Kaur, ma'am. Before we move ahead, we take a moment to recognize the moderator's contribution. I now invite Mrs. Nirmala Londe, Faculty of Nursing, for the moderator felicitation. We now transition to the symposium titled Charting Priorities for AI Research. We are honored to have Dr. Vaishali Jadhav, Dean Faculty of Nursing and Principal, Bharati Vidyapeeth Deemed University College of Nursing, Navi Mumbai. Serving as a chairperson and moderator for this important academic segment, I now invite Mr. Samson Kambre, Faculty of Nursing, to introduce the chairperson.
Thank you, Nikhil sir. It is my privilege to welcome Dr. Vaishali Jadhav Madam is an eminent nursing academician and visionary leader with the 23 years of distinguished experience. I call the panelists of symposium kindly take the chairs. I call all the panelists of the symposium kindly come on the dais. I call Dr. Sunil Kulkarni sir, Dr. Rishi Avasti sir, Dr. Dhanraj Babu sir, Dr. Bahubali Getugul sir, Dr. Baswant Dudum sir, and Dr. Bhagyashri Jogdev madam to kindly come on the dais. It is my privilege to introduce our today's chairperson, Dr. Vaishali Jadhav madam. Is an eminent nursing academician and visionary leader with 23 years of distinguished experience. Madam currently serves as a Dean, Faculty of Nursing, Bharati Vidyapeeth, and Professor cum Principal of Bharati Vidyapeeth College of Nursing, Navi Mumbai. Her career reflects academic excellence, impactful leadership, clinical expertise, and significant contribution to nursing education and public health. Madam has completed her undergraduate, postgraduate, and PhD nursing from the Bharati Vidyapeeth deemed to be University, Pune. Regarding her professional journey over 2 decades, Madam has served in prestigious institutes including Bharati Vidyapeeth deemed to be University, Dr. D.Y. Patil University, ITM Institute of Health Sciences, and MKSSS. Madam also brings rich clinical expertise from the posting at Tata Memorial Center and Jahangir Hospital and specialized palliative care training from the Cipla Center, Pune. With respect to academic leadership and governance, Madam has been BOS member at Bharati Vidyapeeth deemed to be university since 2018 and chaired MHS Inspection and Staff Approval Committee. Madam previously served as a chairperson of BOS and academic council member at Dr. D.Y. Patil College of Nursing. Madam is esteemed external expert, examiner, moderator, and paper setter for undergraduate and postgraduate across Bharati Vidyapeeth, MUHS, D.Y. Patil University, and Krishna Institute of Health Sciences, Karad. Madam is also UG and PG guide, also a PhD guide. In the area of research contribution, Madam has over 20 research publications in Scopus, Web of Science, and UGC listed journal. Madam has presented numerous papers and posters at state, national, and international platforms, including Made Inspire and ANS India, and served as a reviewer for the MGM Journal of Health Sciences. As a resource person and trainer, Madam is sought after speaker with contribution to more than 20 national and international conferences. Madam has served as a trainer under ECO India for the cancer prevention and COVID infection control. Madam delivers exposition on the various topics related to nursing. In terms of organizing leaderships, Madam has successfully led more than 50 state, national, and international workshops, CNEs, and conferences as an organizing chairperson or secretary. Her leadership style extends to training initiatives in collaboration with ECO India, MHS, and various government bodies, strengthening capacity building in nursing and community health. Looking at her awards and honors, Madam is a recipient of the Dynamic Young Principal in 2019 by a Society for Research Development in Health Sciences. Madam has been honored with Rotary Club of Pune for dedicated nursing service in 2004 and recognized as a Best Bedside Nurse Award in 1997-98. Madam was also awarded All-Rounder Student during her academics, which reflects her consistent excellence since the beginning of her academic journey. With regards to her community and outreach contribution, Madam has played an active role in community initiatives such as a national workshop, awareness programs, author capacity building, health education drives in Pune and wherever across the India. Collaborations with the civic organization and government departments highlights her commitment to the public service, public health, and social responsibilities. With this brief introduction, I respectfully request Dr. Vaishali Zado Madam, chairperson of this symposium, to kindly take over the session and introduce the esteemed panelists. Over to you, ma'am.
Good afternoon, everyone. I know this is the last session and we have already crossed around 12:15. But definitely, timing will be kept in mind by me and by all the speakers. Okay, so just bear with us for another 1 hour and we'll have validity and you all can go home. Now, one thing is like since yesterday and today morning, we have heard various sessions, everything's related to artificial intelligence. I think this is the last session, very thoughtful, where it is going to deal with about now human intelligence, because to go ahead with the artificial intelligence and to have certain research ideas, our human intelligence needs to play a very important role. Okay, so this is the speakers, what they're going to give you. You will have various creative ideas in your mind where you can definitely implement in your academics as well as in the clinical fields. With this, let me take a chance to introduce my first speaker, Dr. Bhagyashree Jagdev. Currently, she's working as a professor cum principal, and she's the HOD of Child Health Nursing with more than 20 years of experience. The madam had a chance to visit international visit at an university of Southeastern Norway for the academic policy development. Madam is an ad hoc inspector for Indian Nursing Council. She's also a CAP director, has conducted various PhD research activities related to she's been a PhD research advisory and a selection committee member. She has organized the CPD for more than 30, and also she has taken initiative in disaster response in Kilari Hathwik, Mandra Devi Stampede, and pandemic frontline worker. She has an exposure at Tata Memorial Hospital as an examiner and supervisor. She's been a supervisor at various universities. She has also contributed as a book chapter, which has been published by CBS Publishers. She has been book reviewer for the nursing procedures for child health nursing. She has been research guide and currently guiding 4 PhD scholars. There are 2 patents published on her name and also 1 copyright has been registered. Madam has around 42 publications, national and international, in Scopus, Web of Science, PubMed, and UGC Care listed. In terms of her achievement, she's been awarded as a Best Teacher Award from TNICT branch in 2014. She is also the winner of group dance competition from TNICT branch in 2011. She has awarded as a Best Nurse Award from Rotary Club Pune in 2000. Also, she has been received as a merit in diploma from Maharashtra Nursing Council in 1992. Madam had received various appreciation in her tenure. To name few: Utkarsha Foundation for Social Contribution, Patrakarita Sangharta for Social Contribution from TNICT branch, International Marathon Organization Pune, Indian Medical Association Pune. She also has got an appreciation award for Samaj Bhushan from Arya Ravi Second International Film Festival, Janajagruti Seva Samiti for her excellent work in education, and Sahitya Bhumi Social Media for contribution in education. Madam will be speaking about the research priorities, which will have a contribution about AI in terms of her specialty, that is child health nursing. Over to you, ma'am.
Just a moment.
Good afternoon, dignitaries on the dais, off the dais. First, I want to thank the management and the organizing chairperson to organize such a wonderful conference with the act theme, which is related to the current. Okay. So without taking much more time, just I want to talk about my topic. The topic is given to me, the charting priorities for AI research for the pediatric. If you just see the word charting, I interpret the charting word as a chatbot assisting research tool in the pediatric nursing. How we can use the AI in our pediatric. Okay. So pediatric is definitely different from the adult. The significant feature of that is there is a huge variation in the growth and development of a children from nation to nation, from different geographical locations. We are getting a different patterns. So it's very difficult to put the AI in the pediatric. So whatever you people are doing the research, you might be collecting some data, you are preparing some Excel sheets, and the AI helps to transfer that data into essay. If you see, you are getting the numbers, symbols, then you are trying to create some information. Just observe the pyramid. The last is the wisdom. Just the Justice Madam explained about that. The AI will not give that emotions, that understanding, that domain. Our objective is we have to try to reach at that level. So AI transferred in the pediatric healthcare to support the diagnostic evaluation. As you know, the under 5 mortality morbidity rate is the indicator to announce the country is developed, undeveloped, or not developed. Then personalized treatment strategies. Definitely personalized different strategies are helpful for each and every corner of world. Then prognosis prediction, outcome predictions. Every parents, every medical person are worried about the outcome, and we know till the end we are not able to predict anything because there is a variation in the parameters. But the AI will help you to identify the outcome. So just before that, I think yesterday's session, you might be aware about what you mean by the AI. It is a branch of a computer science. What it gives, it's understanding the different language and recognizing the pattern. Yes. Then how the AI helps in the pediatric? It is just improving the survival rate of the pediatric age group. Then the ML, that is a machine learning. Machine learning is what? It develops the algorithm and statistical models which perform the specific task without the explicit instructions. Then where we can use that ML models to prevent the climate changes are affecting the children's health. That we can avoid with the help of machine learning. Then another one aspect is the DL, deep learning. The multiple layer of information is there. We know in the pediatric, so many disease conditions we are labeling as a idiopathic, multifactorial. These whatever the things are there, it will give the input about whatever if the patients, if the family is putting some history before 2 generations, 3 generations, the coming generations, the AI is able to predict the health status. That is the deep learning. Then the next is LLMs, large language data models. Okay, these are helpful. You people are using the GPT, that is the generative pretend transforms. With that, clouds as well as the Gemini. These are the LLMs model we are using in our researches. With that, these are some examples from the pediatric point of view. The first is the Hero, which is, it is not used in the India, it is used in the USA because we all know in the artificial intelligence, US is at the topmost. They are using these apps to identify the conditions. It indicates the risk of sepsis in the neonatal patients, and the neonatal sepsis is a major contributing factor for the neonatal mortality rate. Then the next is Olet Dream Sock. It is again the sudden infant death. To reduce that death rate, this will give some alarms. Then the next is Empatica. It will also help to identify the seizures. Then the next is Etiometry. It will analyze the hypercapnia in the children. Then the Bone Expert, it will identify the bone age of the children. Means in some cases of crime cases, we can say we are able to identify. Then the Canvas, it will again work for the ADHD children. Then the Bright Heart Prenatal Cardiac, it will work to identify the congenital anomalies. Then the Pen Check, it's very, we are fond of that flag scale. We are identifying the different facial expressions and trying to give the score, how much pain is there. But nowadays, just if you are clicking the picture and putting on the AI, it will give the children is suffering from what type of pain. Now, the different cries are there. We know in the growth and development, a child able to speak at the age of, it will start at the age of 1, but at least able to speak at the age of 2 years. But the AI gives a different languages. They are trying to interpret the different body language from the child's growth and development and trying to identify what the child wants to say. Then again, the same things, you people are using the different apps. Different hospitals are having different apps to schedule the appointments with the doctors. We know we all are from the nuclear family. It's very difficult to go and have a number, just stand in a queue. For these all things, the AI helps a lot for the families. Then managing the electronic health records. I think in the morning, whatever the session I attended from the Justice Madam, it's full detail about what are the AIs available in the hospital setup. So definitely the madam is talking about that the robots are replacing the nurses. Definitely not. Yes, but the numbers, the quantity of the nurses might be decreased. Then the billing, staffing, administration of the beds, all things we are using the AI for the pediatrics. Then this virtual nursing assistant. This is the one Provis Studio. It is, I can say the MUHS is collaborating with this Provis, with the Disha, and they are trying to give the input to the nursing students about the different apps. Just here some pictures about our college. Here we are just having a virtual lab for the slow learners. Then we have a high fidelity, which is based on the AI only. Then we have a an automation table where the 3D pictures are there. The students can do the virtual dissection based on this. And there's a dummy, pediatric dummy we have, which helps to understand the different types of respiration, different types of abnormal breathing sounds, which will help the students as well as doctors to diagnose the client. Then just it's a summary of this, what AI works in the pediatric. It's for the drug discovery as well as improve the patient care safety, efficiency. Then nursing improve the predictive analysis for the patient's outcome, personalized care plans, and administrative task automation. While promising the integration requires nurses to acquire the new competencies to effectively collaborate with the AI technologies. Definitely for my age, again, the AI is challenging for me, but I thank the organization. They gave me the topic and at least I tried to do something, find something related to the AI. Just there is one research, Artificial Intelligence Index Report 2025. It shows that in 1995, the FDA authorized the first AI medical device. By 2015, only 6 devices has been approved. And now in 2023, 223 devices are approved by the FDA. See the growth of AI. Within the 8 years, we are more than 200 AI are there. Then the studies released in 2024 suggest that the AI generated synthetic data can help the models better identify the social determinants of health, enhance the privacy preserving clinical case presentations, risk predictions, as well as the facilitate the discovery of new drugs compound. The medical AI ethics publication shows the last slide what the Jasneet madam displayed. It is related to that only. The number of publication on ethics in medical AI is nearly 4 times more. In 2020, it is 288. Now it become in 24, 1031. So the ethics, when we are using the AI, the ethics is a core component of the whatever the AI we people are using. So whatever the research you people are doing, you may are using the chat GPT, organic or inorganic, whatever the things are there, just be conscious, avoid the plagiarism because it will decrease the generalizability and credentiality of your own content. Thank you.
Thank you, Dr. Bhageshri ma'am. Bhageshri ma'am has highlighted very important few things. Now, when we are saying, actually, since yesterday we were into this phase that it is just the beginning. I think it is not the beginning. We are far behind as a nurses and the healthcare team members when we are saying within 8 years of a span, AI-related tools or the softwares have raised from 8 to 223. So this is really a huge number and which needs to be taken care of. Madam has also highlighted about the machine learning and algorithms. Yes, this definitely plays an important role. And I think it is not only in one specialty, but all the specialties and including nursing education also. So when the machine is being given the algorithm and when machine is being taught, definitely it is helpful to identify many of the complications like neonatal sepsis and it can be prevented in future. Also, Madam has told about different models about the deep learning and large language models. This will be useful while providing patient care. And this real-time monitoring, yes, this is, yesterday we are using this terminology and definitely I am very sure that this is used in each and every aspect of a patient care and this is going to be useful. Many of the hospitals are using it, but I am sure that many of the hospitals which are in the remote area are not being still using it, and this is our responsibility as a nurses that we should pass on this message and we should also start taking part in this where we can start working with these different kinds of a software and we can initiate these things in the hospitals. Thank you, Bhageshri madam. Now we have the next speaker, Dr. Baswant. He's an associate professor in medical surgical department and head of the department. He's currently working in VIDYAPEETH, deemed to be University College of Nursing, Sangli. He had pursued his UG from Government College of Nursing, Bangalore, Karnataka in 2005, PG from Bapuji College of Nursing, Devangiri, Karnataka 2009, and he has completed his PhD from Bharati Vidyapeeth College of Nursing Sangli, Pune, 2023. With an experience of 17 years of teaching, he had 28 research publications in peer-reviewed Scopus Web of Science and PubMed Index journals. Dr. Baswant has Google citations, 458. He's also has a PhD and PG guide. He's a certified trainer in HIV and AIDS, tuberculosis, diabetes education, and palliative care. He's a journal editor and reviewer for reputed nursing journals. Dr. Baswant, you can proceed. If you're comfortable, you can sit and present or.
Thank you, madam, for the wonderful introduction. And good afternoon, audience. Good afternoon, all the dignitaries on the dais, Thank you for giving the opportunity to speak on the topic that is charting priorities for AI research in medical surgical nursing. So, first and foremost is AI as like, for example, it is the tendency of a human behavior to reject first everything, whatever new things are coming to the market. Like say, for example, computers, when it was introduced, many of us thought that computers are going to take our jobs. Many of us thought that we are going to lose the jobs, but actually the computers helped us like to generate the jobs. Similarly, AI is going to generate the jobs and not going to take our jobs. So that is why we are supposed to get acquainted with AI, and that is why we are having this workshop, this conference. So we must be aware with AI related knowledge and how we should do research into the field of AI. So, Madam Jasneet Ko, she had already talked on these topics, that is clinical decision support system, predictive analytics, robotics and automation, virtual nursing assistants, mobile health and sensor-based technologies, natural language processing. These are all the AIs which already Madam has talked on it, and I don't want to waste your time. So simple small examples I'll be giving on this. Clinical decision supports where the AI will interfere into our electronic health records, and it will try to identify the risk, and it will help us to take the decision. Similarly, predictive analysis here, readmissions or future any infections which are there, it can be predicted, and that will also help us to take timely decisions. Then robotics and automations. Here, like Madam has already shown you the disinfection robots which can be used for cleanings. Then virtual nursing assistants. These are nothing but the chatbots or the 24/7. The nurses can take care of the like whatever questions the patient is having. Those questions will be answered by these virtual nursing assistants. Then mobile health and sensor-based technologies. A simple example here is smartwatch. Wearable devices which we are having, these are the mobile health or smart sensor-based technologies. Then natural language processing devices or AI is where whatever the nurses talk to the patient, those data is converted into the electronic health record, where right now we are either typing or writing with our hands the patient record. That is being converted directly during the communication into the electronic health records. So application of AI in Indian hospitals. These are some of the examples where the AI has been used. It is not only these are the hospitals. These are some examples which I am giving you. Apollo Hospitals implements AI for predictive care, voice-assisted documentation, staff workload reduction, patient risk monitoring, and connected care solutions that benefit nurses directly. Then Manipal Hospital uses generative AI for nurse handoff process, automation, shift transitions, documentations, care connectivity, collaboration with Google Cloud for innovation. Then Esther DM Healthcare, it invests in AI for diagnosis, patient monitoring, and predictive care, including personalized nursing interventions. AIMS, Delhi and Rishikesh is designated as Center of Excellence for Artificial Excellence, actively implementing AI-driven healthcare, benefiting clinical and nursing operations. So these are some of the hospitals which have already started implementing the AI tools. Now, priority areas for AI research in medical surgical nursing. First one is clinical decision support, where you can develop AI tools that assist nurses in identifying complications and making timely decisions. Now, whatever I'm talking here, it is not that it is not been researched, it is not there in the market. It is there available. But still there are some deficiencies, there are some errors or there is a cost effectiveness which is there. So that we need to consider, and we have to bring up the cost-effective devices or cost-effective AI which can be implemented. Especially for Indian scenarios, it is very important for us to learn AI or use AI. It will help us because we have a vast population. We are dealing with a number of patients. Each nurse is dealing either 10. Somewhere if you go to in government hospitals, I think somewhere it is 30, one nurse is equal to 30 patients. So this is the major drawback area where we can find solutions by using AI. So then predictive risk monitoring, use machine learning to forecast post-operative infections, readmissions, and deteriorations. Again, this is a challenging area in MedSearch where it is very difficult to control the infections where we are lacking. So it is important for us to deal with or prevent the infections. So here by predicting the risk infections, we can prevent those infections in the ICUs or into the wards. Workflow automation, again, explore AI-driven documentation, scheduling, and resource allocations to reduce nurse burden. So as I told you, we are already dealing with the burden where there is a lot of workload on each single nurse. So that can be again done. Then patient monitoring system, integrate AI with wearables and sensors to detect early signs of distress or abnormal recovery. So we can have also create monitoring devices which are now say for example like smartwatches. When it was introduced early, it was there with big brands only, and only big brands used to sell those smartwatches and very few people used to use it. But now the smartwatches are into the market with 700 and 800 rupees also. So you can use those devices. So like that, if it is cost effective, every individual start using it. Similarly, even the hospitals. Then natural language processing. Again, to this, I think no hospital in India is using this natural language processing, where the data is directly converted with the communication. Personalized nursing education. Use AI to tailor training modules based on nurse performance and patient needs. Here, Madam has already spoken regarding the tutor, where the AI tutor will answer the questions of the staff nurses or the students. Or else you can also use it into the patient education system. Then ethical and human-centered AI, investigate the impact of AI on nurse-patient relationship, autonomy, and ethical care delivery. So ethical, this is a major area where we are supposed to get concerned, because all the data which is there into the computers can be stealed, or the confidentiality is very difficult to maintain. So which is the major area of concern. So you can think of this, and this is the major area of research or focus area which we can control. Then interoperability and integration. Ensure AI systems work seamlessly with existing hospital technologies and workflows. So whatever AI we are going to bring into the market, or whatever research we are going to do on this AI, it should be seamlessly used into the hospitals, because if you ask some hospitals to make major corrections, then it is the hospitals may not accept it, whatever infrastructure they are having, in those infrastructures only they have to work. So it has to get adapted. So that is why, again, the cost also is very important, and also the adaptability by the hospitals. So these are some of the focus areas in the hospitals which we are supposed to look upon and do research and come to we should be able to get some new devices or new AI which will help us to decrease our burden. So these are some AI nurse robots that are changing healthcare. IRAC, which stands for AI-driven robot for ambulance and care, is a humanoid robot currently in the testing phase, developed in Japan. It aims to tackle the challenges posed by the country's rapidly aging population and resulting shortages of the caregivers. There will be a day here, I think almost the entire world is facing elderly problems. And similarly, in India also, we'll be facing with these elderly problems. So such devices will be able to help us. Moxie is a healthcare robot developed by Diligent Robotics. The robot is connected to hospital electronic health record system and is equipped with robot arm and gripper. It can autonomously navigate hospital environments, including hallways and elevators, to deliver medications, restock supplies, and assist caregivers. So this is nothing but logistics which will be helping the nurses to get the medications or deliver the medications to the patients. TUG is an autonomous mobile robot designed explicitly for material transport within the hospitals and other healthcare facilities designed by Ethon. So again, this is also the robot which will help in delivering the required logistics. Then Genex, also known as Genex Light Strike Robot, is a cutting-edge disinfection system designed for use in the healthcare facilities to combat healthcare-associated infection. This robot represents a first of its kind FDA-cleared invention for microbial reduction in healthcare. So again, the hospitals like in OT especially, we require to do sterilization and all those things. So this device can help us to disinfect the areas, and it is also FDA cleared. So such devices, if you think, these are some of the examples where we can think of doing researches. Again, a very important part in the research here is cost effectiveness, where we Indians lack with the if the devices or if the AI is very costly, then it is very difficult by the Indian sector to adapt. So cost also plays a vital role here. So one of the research study on AI is a study was conducted on nursing workload use of artificial intelligence to develop classifier model by Rosa NG et al. Published in 2024. The highlights of this study were to development of predictive classifier model for nursing workload, identification of the main variables that generate nursing workload, then possibility of automating the assessment of nursing workload, qualification of care management, which is nothing but the knowledge and skills required to perform the job, and the contribution to personal sizing studies, that is nothing but number of staffs, types of staffs required for the project. Thank you. If you have any doubts, you can clarify.
I have some question for you.
Yes. Yeah. Yeah. Yes, ma'am. Legal aspect, madam, as I said, you like ethical consideration is very important. That is, legal aspect will be considered like we have to get clear the device. As I said, you last device that is it is in the previous slide. That is
Means by using AI, each and every healthcare team member should be safe, secured at workplace.
Yeah, ma'am.
Is this area covered by AI?
Actually, to say it is not covered, because that is the where we are supposed to do the research. Ethical concern is coming, legal
That
concern is
the
coming.
human
That is-
intelligence plays an important role because whatever the data is generated by AI, it has to be verified by us. We cannot be completely relying on that. Otherwise, then there are chances of bias or data privacy may not be there. So whatever inputs have been given or whatever data is generated by AI systems, it has to be verified by the user. That is the end product, the nurse.
Because, madam, advocacy is also important. That is.
Yes, sure.
Ma'am, with your permission,
Yeah, yes.
in terms of legally protection of a nurse from doing harm to the patient through AI, there are informed consent related AI informed consents are coming. And they are very soon we all will be getting that to practice actually. Because that protection has to be there. We have to take a separate consent from the patient and patient relatives regarding the AI tools which we are going to use while caring the patient and what are the threat associated or the mishaps associated with those AI tools.
Yes, ma'am.
The word is artificial intelligence, but who is preparing these all tools?
It is human.
We are only preparing, no? So we know what is good for the patients, how we can able to protect our client. Okay, the word is only, there is nothing is as artificial. It is made by us only. Okay.
And one more thing, like if you see any AI used, wherever they are using this AI, like for example, the investigations which are used for a CT scan report is there. So if they are using the AI, there will be a warning that this data is, this decision is generated by the AI and it should be clarified by the signs and symptoms of the patients. That is a clinical data. And then only take the decision. So like that warning will be given that we are supposed to follow it because we cannot completely rely on the AI. Whatever data is available in the system, that one only it is going to extract. It is not going to give you anything new. It is new what we are going to create, we are supposed to create. It is not the AI. AI, what is there in the system, that one only it is going to give. So to give the decision also, it requires human intelligence.
Thank you, Dr. Baswan. Sir has elaborated various aspects in the medical surgical areas. In addition to that, I would like to add in artificial intelligence, when we are saying there are, other than the softwares, the protocols, we do have various instruments, the machines the nurses do come across. Okay, so we can also think of how we can incorporate, the AI into this. To give an example of one or two things here, just like for example in backrest, which is usually it has been seen in the hospital as a manual backrest. Now this backrest can have, incorporation of the vibrations where it can detect the temperature of the patient's back and also detect whether it is very much prone for bed sore, and accordingly the vibrations and then massage can be given, for example. Also, the walkers which are there also can have inbuilt sensors where it can detect the vital signs also, and it would be recorded, and also the steps of the patients with what pressure he or she is doing it, so that we can, see. Actually, these two things are being patented by our college. So that's how I thought of giving example. So thank you, Dr. Baswan. Now we have a third speaker. Actually, Dr. Vijaya Kumbar was supposed to chair this session, but because of her professional commitments, Dr. Dhanraj Babu has last moment agreed. Thank you, Dr. Dhanraj. Dr. Dhanraj is currently working as a professor in Child Health Nursing Department, and he has an experience over more than 20 years. He has done his graduation and post-graduation from Bharati Vidyapeeth deemed to be University, College of Nursing, Pune, and he has done his PhD from Malvanchal University, Indore. He has also completed his certificate course in palliative care and maternal and child nutrition at Medversity. He is a member of BOS at the university from 2016 to 2025. He was been a secretary of IAC committee for a period of 3 years. He has presented various scientific papers at national and international conferences. He has also attended and organized various national and international seminars and webinars and serves as a resource person in workshops, conferences. He has guided more than 25 UG students and PG thesis and is guiding currently two PhD scholars. He's been trained for IMNCI, mental health in COVID-19, NTCR 2019, GCP, ICMR guidelines on biomedical ethics 2017, and hands-on training on SPSS. He's a life member of TNI, NRSI, SOMI, and CNRS. In terms of his achievements, Dr. Dhanraj has been awarded for PhD in nursing by Nurses Vacancy Solutions Private Limited, Mumbai in 2023. He is Distinguished Teacher Award by Global Foundation for Nursing Profession and Social Services, Jaipur in 2023. He's been also awarded as a Best Nurse Educator Award by Eudoxia Research Center in 2023 and Royal Golden Fellow and Best Academician by International Research Council of Eudoxia Research Center. Is awarded for the best paper in national level pediatric conferences, also as an awarded for winner for best research paper organized by Pediatric Association of India. The first prize for slogan competition at World's Largest Walk. He has been awarded for associate professor and valuable contribution for nursing profession and has got an appreciation for online open book quiz contest. Over to you, Dhanraj. Time is for 7 minutes. I want you to stick to time, please.
Yes, 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 ma'am. Thank you. A warm good afternoon to everyone, respected chairperson, principal sir, ma'am, seniors, and all the participants and organizing team. My sincere thanks to sir on behalf of obstetrical nursing. I'm presenting creating a priorities in obstetrical nursing. Research area features sees in obstetrical gynecological are very vast, but mostly it is deal to for the maternal outcome and the fetal outcome. If you see the areas, it could be dealing mostly on data accuracies, algorithm, explainability, clinical validations, and patient consent and bias detection. So in these areas, mostly the obstetrical gynecological AI plays a very vital role. And if you see the areas where we required is to see the fetal outcomes. There is various devices are used like for our sonographies, ultrasonographies. There are various devices are there that I'll be listing afterwards. The use of AI in obstetrics can be like early detections and diagnosis. These are the common which is deal with the medical surgicals and other presenters and resource person also deal. Mostly in obstetrical, it is mostly used in fetal heart rate monitoring, pregnancy surveillance, production and of gestation diabetes. There's a tool which is used to detect the in antenatal it is detect the gestational diabetes, production of preterm labor and miscarriages. There is a one tool which is help to detect the preeclampsia, PPH, and prediction of postpartum depression. So use of AIs are to detect before in the hand if the patient's for the fetal and maternal outcome, the detection is early diagnosis and early treatment can be started. Now, the focusing areas where in most of the thing, like in the previous speaker also it's been on the clinical decisions making. Yes, rightly, in the obstetric also it is used for clinical decision supports for taking, for examples, the patient, obstetrical patient's care, workflow in the documentations and all, ethical considerations. Now, you know, most of them, like it will help to, if the patient is going into a postpartum psychosis, it will be detected. As we've seen in most of the slides that it is used, the most AI is used in the education purpose, patient's outcome and personalized and culturally sensitive care. Now, there are some few studies which says that this studies titles by Dharmesh, Vidyapria and academic. Here it says that most of the devices used for enhancing the diagnostic capability, better maternal and fetal outcomes, enhance the quality of antenatal and antepartum care, and mostly used in detection of complications. There are most of the before you can see there is mostly midwifery complications are there to that can be detected, enhance the reproductive health come, and it also strengthens the clinical decision making in the obstetrical gynecological nursing. These are the few studies which has been seen, and I just highlighted the common outcomes of the studies. Mostly the studies are conducted by seeing that the obstetrical outcome, transferring the care in outcomes and patients outcome in and training the trains of artificial intelligence in OBG nursing. Another one of the studies is highlights the artificial intelligence for detecting the preterm uterine activity in gynecological and obstetrical nursing. Now, these studies mostly emphasize the use of electrohistography, which signal the use of three distinct machine learning algorithms algorithms to classify these signals and to help identify through labor and accurately diagnose the preterm labor. So I say that there is one in future, there will be current focus of this device is the Pregnotech gene MAMA is predominantly used for the 9 months of pregnancy. Now this will detect the AI in maternal stitches for beyond that. So not only in the pregnancy, but beyond that, the postnatal care can be identified. It would mostly highlight on the breastfeeding, sleep, baby sleep pattern, and even early childhood development. So in this all role, AI will play a vital role. Now, if you just see, there are various tools, as I told you, for the pre-eclampsia. There is a pre-eclampsia prediction like biomarker analysis. There is a placenta growth factor monitoring. Kaylee Healthcare University of Melbourne had used a device that's a new variable AI device which is used continuously in the hospital also and in the home. So with this device will kept on the mother's abdomen, and she can monitor the growth of the fetal at home also and in the hospital scenario also. There is a baby checker, one of the device, and there is a fetal cardiac imaging, automatic fetal ultrasound. This is a use for the plain detection and biometric measurements. So, and the sonography, we are using the biometric measurements, but AI tools mostly use the in depth about the various measurements by using the various devices. So, these are the important concepts regarding the AI in research and the in obstetrical gynecological nursing. Thank you.
Any questions from the audience? Thank you, Dhanraj. So this is regarding about the gynecological and obstetrical nursing. So he has covered the various areas where researches or AI can be thought of. Mainly, as Dr. Dhanraj has mentioned about Pregnotech and GenMema, which can be used when we are providing the maternal care. Also, I would say this is the different kinds of chatbot or voice-assisted softwares can be useful in terms of where, in cases of infertility where the spouse or the couple are having many questions related to that can be answered, and at the same time in terms of an antenatal and a postnatal care where they do have a lot of questions and it can be clarified through the voice assisted or chatbots. Our next speaker is Dr. Sunil Kulkarni, who is a professor at Bharati Vidyapeeth College of Nursing, Navi Mumbai. He's also the head of the Department of Community Health Nursing. Sir has started his journey from GNM, General Nursing and Midwifery, from Government College of Nursing, Sangli. Has completed his postgraduate and MS Nursing from KLE Belgaum. And he has completed his PhD from BVDU College of Nursing, Sangli. Apart from that, also he had done various certificate courses, that is Office Computing, Diploma in Environmental Education, where he has received gold medal. He has also done a certificate course in Medicine and Law. He has a membership of TNA, NRSI, SOMI, INA, and Sochni. He has, to tell you about the sir's experience, he has started his journey from a staff nurse and now here in College of Nursing, Navi Mumbai as a professor. In terms of his achievements, he's been an examiner for theory and practical examination at various renowned universities. He has been also served as a member of BOS and RRC at BVDU Pune. He has received Best Paper Presented awarded twice and has 8 articles, 35 research publications, and 4 research-related publications. Sir also has been an MNC inspector, INC inspector, BOS member, MNC observer, ethical committee member, UGC coordinator, and has an editorial responsibilities and TNI head of HOD. Over to you, sir.
Good afternoon. Thank you, organizer and chairperson. 30 years back, I was just trying to learn computer. Along with me, there was one retired principal was there. By curiosity, I asked why you are joining this course as you are retired. The line was, he said, that was important. We are different in age, in years. We are different in age, in years, but we are same in one era. So whatever is present around us, that will be same for all. Same thing, this AI has to learn by each and everyone. Topic allotted to me, that is a private sector. It is a big topic, is there? Big area is there. Still, I will make it short with concern our nursing areas. As you know, private sectors, this is a own run by the individual or group. Mainly intention is that to earn certain benefits, but still there are some NGOs are there. They are working no profit, no loss basis. So many areas are there, especially we are discussing today related to the nursing and hospital as a private sectors. Very important, there are about 80% private sector companies, they are using AI. Why AI is used by the private sectors? Out of many reasons, I have taken few of that. First, we are connecting fastly to our consumers or beneficiaries in large amount within short time. Second, we can save various resources. 5M, we are saying, as a man, money, material, measure methods. We are rendering the quality services to both service provider also as well as our consumers satisfaction. And everyone must remain updated. Out of the oceans of various examples used in nursing, I am taking only few related to particular various areas. In short, try to say what is its function. Already this point was discussed, virtual nursing assistants. It helps for checking various assessment of the patient, provides 24/7 health education as any message is given by the prompt or any way of stimulation. Send the reminders and follow-ups to the patient. Those are working in different areas. Second one is personalized patient care planning. Example I have taken, that is a care stroke. What it works, recommends the database personalized care for every individual. So whatever the data is given of the particular individuals, personalized care will be provided. Even the same disease is there, same age is there. Monitor and report the actual and potential risk of every individual. Time to time, whenever there is up and downs are there will be signals are provided. So everyone will be aware about that. Predict the patient's outcome at the starting point to the till exact outcome comes. AI powered documentation. Example I have taken here is Suki AI. How it is useful? Because continuous by various ways, they are receiving the information by the data, by the visual, by the talks, or whatever the interactions are there, and that will convert it into the record in the form of written or as a recording. Allows hand-free communications. So by walking, talking, the recording will be going on. Pulls the relevant data related to our recording purpose from whatever sources are there, like EHR. Next one, I think this is popular, administrative and operational AI. Example is AXA, sorry. So function, it helps the managing the patient schedulings, and it will be given information to each and every members. Those are present directly or indirectly also. Secondly, it manages the staff's work scheduling. Time there will be plan as well as intimation. And third points, it also keep the record which functions are completed or remain. Inventory management, not only inventory of the things, it is inventory of each and every actions which is performed in a particular health setting. In nursing education, one example is I have taken, that is a Nursify AI. What it does, it gives somewhat all the information in the various modes. Teaching with AVAs, that is very powerful because words, voice, actions are there, and repeatedly you can see. Setting the question papers and evaluation, considering the individual routine and competitive exams also given by this app. Give the guidance to solve the teaching learning problems to both teachers or students. So related to research, every area it is covering. There are few examples already you are using. The functions of that apps, it prepares research synopsis, Whenever you have some ideas, you can put with the prompts, you will get research outline within short time or fraction. Data analysis is part of the statisticals. Put your data, give the proper tests, it will give the details along with some part of the presentation in different ways. Draft the research article and publications. So we have to just use our brain to relate and make it relevant, free from the ethical and legal aspect. Plagiarism detection, also it has said to minimize the plagiarism or correction of certain things. These examples already my colleagues have given. With the last, I can say this AI we have heard newly in the world, but my experience is in Maharashtra, especially, we have heard this word long time related to mother AI, do this everything for us, each and everyone. So how she works with patience, energies and appellation, safety, security. Thank you.
Thank you, Dr. Sunil Kulkarni, sir, for covering the private sector in terms of research opportunities regarding the AI. Now, he has showcased various examples. Now, when we are thinking about these examples, I would say we really need to ponder upon when, like, for certain research ideas as how we can improve the communication. Are there any problems or can we directly, change the language which is easy for the patient to understand? Or how we can protect the data privacy, having the blockchain technology where the data is not being relieved to anyone else, or how we can plan an individualized care based on the patient's data which is being received. Okay, so when we are dealing with different robotics or different kinds of softwares, so these are the certain ideas which we really need to keep it in mind as a PhD scholar or a PG or even as in faculty when we are planning to conduct research. Thank you, Dr. Sunil Kulkarni, sir. Now, next we have Dr. Rushidat Avasti. He's a nursing faculty from AIMS Jodhpur. He has been a resource faculty for executive postgraduate diploma in PSC management for CHOs from PGI Chandigarh. He was a professor and head of the department in Swasthya Kalyan Institute, Jaipur. Worked as an associate professor and head of the department at SIIMS Nursing College, Indore. Board of Studies member in Rajasthan University of Health Sciences, Jaipur 2013 to 2019. He had completed his PhD nursing, is of course PG and diploma in health hospital administration. He has received merit certificate award from Vice Chancellor from the Maharashtra University of Health Sciences in PG academics. He has 40 index publications with 122 citations. He had 22 oral research presentations at various national and international conferences. He has 2 patents to his credit. That is, one is patent for design hydrogel container in United Kingdom and Indian patent for blood sample transport container. He has been author for 4 nursing textbooks and is registered nurse in NCLEX US. He'll be dealing about the public sector. Over to you, Dr. Rushi.
Thank you, ma'am. First of all, it's my humble gratitude to Bharati Vidyapeeth Deemed University College of Nursing, Sangli, for their management, and especially for Dr. Suresh Ray, who invited me here for their AI most recent, most conscientious trend, which is coming in nursing. Whenever we will talk regarding the public health, first thing, whenever we talk about the public health, we know what is India's condition, because still we are struggling for healthcare delivery system and equity and equality in India. Whenever you need equity and equality in India at the root-based level, till after 78 years of the independence, we could not get because of the human interference. Some manipulation is there. Somebody is doing the manipulation. I'll give this recent example. Before 10 years, Government of India settled that IMR should be 25 till 2025. And it is there 25. Whether this tremendous declination is there or it is declining so far, so what is the existing condition? It is doubted. We are not considering 100%
institutional deliveries, even with the recent data, I can say 7 to 8% deliveries ASHA and trained labs is conducted in tribal area of India. Where is that IMR status is there? Even we are not having sufficient technology at the root level. Changing the name of the sub-center with the health and wellness center, with the Arogyam Mandir, it doesn't matter that how much you are providing the technology and how much you are changing in an existing condition of the infrastructure. The AI, for my justification, I can say that AI is not justified for the root level till now, until and unless we are having the recent and most prominent technology in India. But area of research, definitely we can do. I will not go with the PPTs because it is already, we have discussed. I'll go with just the personal experience, what you can share and I can share with my things. We all are doing as a community health nurse, home visiting we are doing. But there is no authenticity, always questionable whether we are attending the home or not. ANM should do home visiting, ASHA should do home visiting in public health system, whether they are doing, they are just going or not, nobody will get a authentication. How the AI help in that? We should go for the AI geotech. We should initiate in a global position system. And that initiative is taken in a Alwar district in Rajasthan, that whenever the ASHA, any healthcare worker will approach to the any house or any area, she or he should be geotagged and she should send the picture to their particular center. That area we should improve with the help of the AI research. Every app, whichever the health worker is having, even ASHA is having their own app, ANM is having their own app, that all app should be connect with the AI or global positioning system. Then the correct data will come. How the AI will help in that? Because they are having the technology in their head through the mobile. But they are just filling the data. We don't know where they are filling, how they are filling without any having the right statistics in their hand. So better to go with the global positioning system through AI so we can get a right data or right condition of the Indian health scenario. Second thing, when we talk about other advanced modalities, we are coming from the root level. Still 60% of the India is staying in a rural community. And they are still struggling for the high advanced diagnostic procedures. And one thing why I'm very unfair with the practical, with the myself also, if you do a MRI in a high tertiary center, if you take the CD, we always tell to the patient, okay, take your CD, we will check another tertiary center also. But still in India, government is not having a single software and single AI software to read all MRI reports. Here we are lacking really in AI because when a poor person is investing more than 7 or 10,000 on a single MRI, or he cannot read that MRI, even the other expert cannot read a MRI out of this other tertiary center. That area we have to improve really in AI as well as the technology, single language for all the diagnostic procedures. No doubt. E-Sanjeevani is a great action from the Indian government, telemedicine. But we have to take initiative because they are creating, I'm telling the practical problem of the E-Sanjeevani. E-Sanjeevani, they are creating a portal or giving a login ID or giving an ID for the particular person, but how much they are waiting for that? Sir, whether my report is came or interpretation came or not, whether every time they are getting the same doctor, it is not possible. They are starting with the new, if they are getting the new doctor, they are starting with the same algorithm will be not there. So E-Sanjeevani should inculcate, or we should do the research with the E-Sanjeevani with AI. So at least for one patient, algorithm should be there. If doctor is changed, he or she can see from where we should start. Because every doctor is starting from the pinpoint only, from the starting way. And it consumes a lot of time. That time we can reduce with the AI in public health sector. So all the things we should take with the age, we should include AI, not AI, high technology we can say in public health. So we can get it correct things, reduce the time, or at least a patient who is staying in a village area get the right result, get the good prognosis. Next, for the students, we all are doing the home visiting. And our main tool is community health nursing bag. Yes or no? We have to get some advanced technology in that. Because it is very unfair to say me, I have not seen a single protocol how to do the bag technique. Till now, even is not a government of India is having, because everybody is following their own steps. And we are in big jumble, which step we should follow, because one teacher told the things, at least we were working from 1970s until now, it is now 2025, we have to get advanced in a bag technique. We should include some technology. We should include something, whether the student is going to that particular area. New initiative in my institute we have taken, all the folders we have generated electronic data. And it is feasible. All the students, they are filling with the electronic data by their mobile. So at least we have a big data where we can do a easily analysis. Because when writing data is coming with a folder, it is quite difficult to get analysis in a single thing. We are now working for the artificial intelligence in that, because it is really difficult without a technical support. And now, if you are inculcating AI, they are asking more than lakhs in a single software. So we should include in that. So automatically we could get an analysis of the, if you are going in a new area, just collect the data and you will get an analysis of the data. So that are the things we can improve in public health system. Still our public health system or rural India is so far with the AI, especially in health concern. So this is all about my side. Thank you very much for your kind attention.
Any questions from the group? I think everybody is exhausted. Thank you, Dr. Rushi. I think, yes, definitely we are thinking, we are telling about AI. Everything is maximally done in urban areas or the cities. But the remote areas or the tribal or hilly areas where home visiting still is a challenge. And I totally agree with you, where we can have an empowering the use of AI. If we have a geofencing, it would definitely help us to provide a better care. Also, you have also told about the rural community where an high advanced care needs to be provided and diagnostic centers are not available. So it's a challenge, I think, for not only for every community health nurse, but in each and every nurse who is also working in the hospital where the home visits can be channelized, so that and with the incorporation of AI research priorities, as where we have certain diagnostic tools where patient gets a diagnosis then and there for at least a certain X-rays or CT scan or MRI, certain investigations, then that can save time and diagnosis can be done beforehand. Yes, we do have a lot of data. The analysis of data itself is where we can conduct a lot many researches. Definitely that would be taken care of. Thank you, Dr. Rushi. Now we have the last speaker, Dr. Bahubali. He is currently head of the department at Bharati Vidyapeeth College of Nursing, Navi Mumbai. He is an IQSC and NAC coordinator for BVDU Pune. He is also an IAC member of BVDU Con Sangli. He is a life member of TNI, ISPN, CNRS, and also Ethiopian Nurses Association. Dr. Bahubali has completed his post-graduation from Dr. M.V. Shetty College of Nursing, Mangalore, Karnataka, and has completed his PhD from Sri Venkateshwara University, UP. He has more than 17 years of experience. In addition to that, he does have an international teaching experience for Harmaya University, Ethiopia, Africa. He has an extensive experience in mentoring, curriculum planning, and research coordination at diploma, UG, PG, and doctorate level. He has led institutional level national conferences, seminars, and webinars. He is an enthusiastic teacher and has an application of computerized knowledge in nursing. He is an active chief editor, journal reviewer, and active contributor to national and international nursing journal. He has participated in faculty research capacity building program. He has more than 21 research papers, more than 20 publications in Scopus indexed, 4 in Web of Science indexed publications. He has published 2 books, 3 patents are to his credit, and also he has in citation more than 100 with an 5H index. He has been awarded as a research champion at CRPU BVDU Pune and best research paper at NRSI Best Teacher Award in 2023 and 2025 at BVD College of Nursing, Sangli, and has also got an international prize for academic excellence. He is dealing about the mental health research priorities, and I think this is the most neglected area. Over to you, Dr. Bahubali.
Yes, thank you, ma'am. And thank you all the organizers for opting me for to be a speaker for this occasion of charting the priorities of research, including AI in psychiatric nursing or psychiatric mental health nursing. So rather going into the details of each and every slide, I just would like to make a point that why research is important. Because in my view, research would bring us to the clarity of the things which are we are currently into in terms of artificial intelligence. Because you all can recall the scenario where COVID-19 had arrived at our doorstep and we were unaware, our minds were scattered, we were not knowing what to be done or what is the solution for that. So similar thing which is there existing in terms of artificial intelligence and bit advanced, we have entered into a conceptual to the planning phase of artificial intelligence. So this very conference is very essential for us to understand the importance of it and in terms of research. So as I told you, the research is a very integral part of any development of clarity. So to bring in that, to practice these artificial intelligence into our area of practice with ethics and ethical steps by including a lot of clarity into the aspects. So it's very essential for us to take it in a research spirit rather than order spirit. Somebody tells you to do, don't do that. Please clarify yourself by conducting a research, micro research at your level, or conduct a formal research and try to come out with its findings and generalizations and then try to adopt, because these AIs, we are not going to develop. Who are we? We are the utilizers of this artificial intelligence. Because we may give a feedback to the developers that we need in such a way. These are the intricacies, these are the difficulties, and but we need to identify those difficulties while using this. As rightly Avasti sir has pointed out, that we need to suggest what changes we need into that. And yesterday also the speakers were talking all about that. So we need to identify the areas which we need to be improvised into the existing AI tools through research, and we may come out with empirical findings, and those changes can be made into in terms of algorithm of different AI tools, and that can be implemented in a well-versed manner so that the patient care is effective. So that is the importance of research in nursing in relation to artificial intelligence, which I just would like to highlight. And in terms of mental health nursing or psychiatric nursing, these are the areas, there are a lot of difficulties which we face every day in a clinical practice of psychiatric nursing, where patients are non-adherence or non-compliance to the medication. 99% of the hospital beds in psychiatric units or hospitals are occupied with missing of dose due to various reasons, and that too with the research we have come out with many of the causes which makes them to stay away from medication due to finance or accessibility, availability, affordability, conveniency of a family member to take care of their psychiatric patient. So these all matters could be resolved by bringing in those AI tools which can be useful, such as maybe chatbot. It is a very handy tool which we can just chat. We nowadays have all that chatbots for many of the user-friendly applications which have been made through chatbots. We put our query, it generates automatic answer to us. So similar things can be done for the psychiatric patients and their relatives to minimize the missing of dose or non-compliance with the medications. That is very important for all of us to understand. Conditions like depression, anxiety, some of the psychiatric emergencies such as post-traumatic stress disorder or suicidal tendency, suicidal ideations or suicidal attempts. Okay, these are, and one more very important hidden ghost in the community is that the minor psychiatric disorders. Those disorders which are not symptomatically prone to show up, he is a patient, and they are tolerated within the community, and they are not brought up to the medical attention or psychiatric care attention. So these areas can be tapped to identify their need for the hospital care or OPD-based care, and such artificial intelligence devices can be brought into a service which can strengthen the identification of patients at early stage. So these another area that is a chronic disorder, psychiatric disorders like schizophrenia or bipolar affective disorder, which needs to be studied more depthly by their cognitive abilities and the way they think and their emotions which they express. So if we can understand these intricacies, the simplification of nursing care and psychiatric treatment can be done and the prognosis could be more beneficial for these chronic disorders. Even the similar with the substance use disorders. Um, in nursing particularly, the AI would help us, as I told you, we have to put forth our demand into the nursing care area, which we need, which would augment our action and which would supplement us while performing the action so that all the effective care can be given while utilizing the human intelligence, that is by a nurse intelligence. So while assessment, diagnosis, this is like imagining studies or imagining tools which are available to understand. So subjectively getting the information from the psychiatric patient, it becomes very tedious task unless and otherwise you are an expert into that. So these AI tools would help to recognize the facial expression, the algorithm which are set like the expression or the language which is spoken by the patient can be interpreted as a, that is like predictive analysis can be done and it can be understood what patient is going through, or identifying a person with a suicidal risk can all be done through these algorithms and the AI tools which are devised, and we can identify and we can prevent such mishaps. So this is all possible through assessment, diagnosis, then even care plan, improvisation, because we focus on individualized care, because AI would give you just generalized intervention suggestions. But there should be AI tools which can help us to give individualized care, and the algorithm has to be so strong and authentic that it gives us precise intervention to be done for that particular patient. Even patient monitoring can be done, like as sir also mentioned that, and educational training, which we all are doing right now. Like we are using all the AI tools to enhance our comprehension related to artificial intelligence. And psychological support also can be rendered through chatbots and virtual therapists. I'm going to show up that slide where the institutions who are using this AI technology already into mental health sector. So in my nutshell, like I can conclude that the AI can augment the nursing action rather than replacement. Okay, and AI can allow us to reach to the unreached. It's very important. And as I told you, I gave a scenario of minor psychiatric disorders or the chronic conditions who cannot be kept for a long duration in the hospital admission. So they have to be in community. So we have to reach them. Through AI tools, it's very convenient for us to reach them and enhance our assessment, identification of problem, treatment, and patient care can be more effective through psychiatric nurse. So there are certain initiatives which have been done through government and private sectors in terms of psychiatric nursing and psychiatry as a subject. So ICMR has come up with research guidelines which are very evidently mentioned about artificial intelligence and its guidelines to use in the while doing the research, as well as these artificial intelligence are also useful in one of the very convenient method which has been introduced by central government of India, that is national strategy for AI, as sir mentioned. And the very important aspect which includes about mental health is the telemedicine or telemanas, which has been named, which was launched in 2022, 10th October, that is World Mental Health Day. So this is very user-friendly platform which the user can access, any one of us can access during our psychological difficulties or any psychiatric related complications which we encounter ourselves in the family or by the patient, can access to these telephonic intellectual or experts, and they will counsel and they will give you advice, and the effectiveness can be observed there. So these are few examples which were already spoken by other eminent panelists. So specifically to mention about psychiatric thing, like NIMANS Bangalore, which is working on conducting several studies are ongoing, and they are establishing the policies, and
the documentaries which can be followed by all of us. And then AIMS Bhubaneswar, AIMS Delhi, they are working on, they have established a artificial intelligence research and development cell, and they are a center of excellence now. Then this one of the hospital in Bangalore, that is Amaha Mental Health Hospital, which uses artificial intelligence powered decision support tool like Safe Treatment or Safe RX, which is a brand name, to improve medication safety for psychiatric patients. Then IIT Kharagpur has launched an AI powered emotional monitoring program for their students, mental health support they call it as a SETU. And these are some case widgets which we can think about. As I told you, Telemanas, which is very notable point where nurses are actively involved in this and helping the many callers who are calling into their mental adversities. And one of the thing which I could come to know that is a Paro robotics, which is there in the top second image, which is robotic, which is very beautifully designed, and there are by Japanese company, and it has been studied through research, and it has given a promising results in establishing the mood stabilization and specifically with the cognitive impaired patients like Alzheimer's disease or dementia patients and old age in general also. It has been proved to be effective to reduce the complexes which are the intricacies which are observed due to cognitive deficit or cognitive declinement. That has been improved, and it has been proved to show that it is stabilizes the further deterioration. So it is very useful, and recently United States of America has given a clearance through Food and Drug Authority, has given a clearance to take it into the market for its sales and utilization. So these are uses of chatbot, how chatbot can be used for mental health nursing.
1 more minute.
Yes. Yes, I'm done with that. Thank you.
Okay.
Thanks for your patience.
Okay, thank you, Dr. Bahaboli. Any questions?
I'll just give you the example how telemanas is as important when they inculcate the AI. Because I was a nodal officer as a telemedicine, and we have initiated names the telemanas. So one person at, I think at 7:30, one call came from the girl, and she was not identifying their identity where she was calling. And she was talking more than 15 minutes. She was explaining their problem. And the expert was the junior resident from the psychiatric. He was taking all the notes and all. But what happened, he was not concluded what is the actual problem is there for that girl. So suddenly, because the AIM psychiatric department was working with the AI tool also, so they just all the verbatism they've transferred to the AI tool with the all recording system. And really that AI tool told that she is having the suicidal ideation. But the problem was there, it was not simultaneously, it was just taking time. So counseling, it was delayed, but now they are working really with the simultaneously when the same person is hearing that sound of the verbatism of the particular candidate, AI tool should work with that. So immediately they will get, because there may be a chances of the human error, but AI will not do a human error. It is Telemanas is a tremendous software for at least as per the Indian scenario.
Yes. So this was an attempt from my side to just ignite your mind and come up with some of the collaborations in research and inculcate those needs in nursing science by collaborating those authorities or technical person so that we can do wonder.
Okay. Thank you, Dr. Bahaboli. What Dr. Rushi has said, I would just like to add, and what Dr. Bahaboli has covered. See, even in chat box, when we are using AI, also the prompt, if it is given how to do a suicidal attempt, it is going to give you a number of attempts. So when we are making actually the algorithms for the machine learning, we really need to be very careful whenever these prompts are being asked, okay, where to stop or to whom to contact also needs to be mentioned. So these are also the certain areas which needs to be explored. Okay, we have come to an end of symposium. Now we have heard enough of AI, how, where to be used. And I think this gives us, 2 days. We are been feeling too good because we do have met with our friends, the atmosphere is good, and then the dopamine is released. And as soon as we are stepped out of the conference, the zeal of you want to do something, kaitari karayachai, that 50% of that actually goes down. So to avoid that, I can request the organizers to have one more conference in the next month where hands-on experience can be given in the workshop, where we actually use the AI, so that that is more useful in the upcoming career. Thank you so much, organizers, for providing us the opportunity. Thank you so much.
Thank you to all distinguished speakers for their in-depth and research-driven contributions. The symposium has provided valuable clarity on future priorities in AI-enabled nursing research. I now request Dr. Vaishali Jadhav, Chairperson and Moderator, to felicitate all symposium members. The speakers are Dr. Bhagyashri Jogdev Ma'am, In Charge Principal, Bharati Vidyapeeth Deemed University, College of Nursing, Pune. Dr. Sunil Kulkarni, Professor, Bharati Vidyapeeth Deemed University, College of Nursing, Navi Mumbai. Dr. Rishi Avasthi, Ames College of Nursing, Jodhpur. Dr. Dhanraj Babu, Professor, Bharati Vidyapeeth Deemed University, College of Nursing, Sangli. Dr. Bahubali Kedugol, Associate Professor, Bharati Vidyapeeth Deemed University, College of Nursing, Sangli. Dr. Baswan Tudum, Associate Professor, BVDU College of Nursing, Sangli. At this point, we take a moment to felicitate the symposium chairperson for her leadership and guidance throughout the session. I request Principal Sir Dr. Suresh Kumar Ray to kindly felicitate Dr. Vaishali Jadhav ma'am. अभी बोला था ठीक। Panelists, kindly take your seat. I request delegates to a QR scan code as the link has been shared in the National Conference WhatsApp group. Kindly attempt the post test. Now I call upon Principal Bharati Vidyapeeth College of Nursing along with teaching and non-teaching faculty for a quick snap. I also invite Dr. Bhagyashree Jogdev ma'am, in charge principal Bharati Vidyapeeth Deemed University College of Nursing, Pune, and Dr. Vaishali Jadhav ma'am, Dean Faculty of Nursing, Bharati Vidyapeeth College of Nursing, Navi Mumbai.
Please bear with us few minutes as all the three sister institutions of Bharati Vidyapeeth, uh, Faculty of Nursing, principals are here. So I would like to take this opportunity that my all teaching and non-teaching staff will have a photograph together. So it is just 5 to 10 minutes, then we'll have your validatory session, distribution of certificates and certain announcements which are beneficial for the delegates.
Before proceeding to the valedictory ceremony, I request our Principal Sir, Dr. Suresh Kumar Ray, to kindly felicitate Mr. Samson Kambri, Faculty of Nursing, for his excellent work in dedicated IT support for this national conference.
I want Rohit also should join.
I also request Mr. Yogesh Bhosle, Faculty of Nursing, for his outstanding contribution and IT support in ensuring the smooth conduct of this national conference. Before moving to the valedictory ceremony, we now invite the representative from Vision Health Science Publisher, Mr. Aniket Sir, to come on the dais.
Hello. Good afternoon, everyone, and good afternoon to all our dignitaries and all our organizing committee of Bharati Vidyapeeth College of Nursing, Sangli. So here I am invited to give some books to the three students which we have selected by the sir. So I will just invite one by one and just take the books from the chief guest. So I will. The first student, I'm just inviting Bhageshri ma'am to just collect the books which we have. These are all fifth semester books. The second student I am inviting here is Miss Sanyami Madane. She is from LNBC Training College of Nursing, Satara. May I tell principal sir to just hand over the books to. And the third student is Harshada Sambhaji Bachate. She is from Ashokram Mane College of Nursing, Kolhapur. May I tell all the two students and come on the stage and just have one photograph with all our dignitaries, please.
Yes, sir. Sir, इथे बस.
Thank you so much. Yes. Uh, we have kept one lucky draw for the students. From yesterday, we have collected some cheats from the students, and I've just we will open the lucky draw from the chief guests. So just in this, we have just selected 3 students.
डबल आले तर तुमच्याकडे देऊ Just a minute. And the first name is Ekta Narayan. Where is she?
Please come on the stage.
Please come on stage. She is from SGM College, Maigaon.
The student is from SGM College of Nursing, Maigaon.
Second name is Swarangi Vishwas Thakur, Bharati Vidyapeeth College of Nursing, Navi Mumbai.
Swarangi, is she available?
Yeah, anyone can come.
Anyone can come.
FILC nursing student. And the third name is, actually the affiliation is not mentioned over here, but the name is, I hope I am correct, Johnny. Johny, Sins. Who is that? Johnny Sins.
Let's take next one.
No one is here, Johnny. Any institute with the 4-letter word, 4 words SIS. Okay, Madam, next. Again, from SGM College of Nursing, Supriya Shekhar. Supriya Shekhar. Please give a round of applause for all the lucky winners. And sir, what we are going to give them?
We will give them the books. Directly, we will send them the books by post to their address. And just we will ask them in which semester or which year they are there. Then we will send them the books.
So 3 of you for getting books from Vision Publication.
Thank you so much, sir, for giving me this opportunity, and thanks for the organizing committee of Bharati Vidyapeeth. Thank you so much, sir. Thank you, everyone.
We now move to the valedictory ceremony. I respectfully invite Dr. Vaishali Jadhav, Dean Faculty of Nursing and Principal College of Nursing, Navi Mumbai, along with Dr. Bhagyashri Jogdev, In charge Principal, Bharati Vidyapeeth Deemed University, College of Nursing, Pune, to facilitate the distribution of certificates. Now I request Dr. Aparna Kare, Faculty of Nursing, to announce the winner and participants of poster presentation.
Good afternoon to all the dignitaries on the dais and everyone. Now it's time which you are waiting for and to recognize and appreciate the hard work and to proceed the announcement and distribution of the certificates of top 3 poster presentations. Total, there were 16 posters, and which was really made excellently with the scientific thinking and creatively. They are prepared even with the papers. It was the created and it was based on the theme. So everyone really appreciate for your efforts and hard work and your creative reflection. The equal opportunity was given to everyone, and the judges were from the outside of Bharati Vidyapeeth College of Nursing, Sangli. So here, I announce the winners and I request the winners to come and receive your certificates and the memento with the prize. And congratulations to all in advance. All us truly winners because the differences were like just 1 or 2 marks. So everyone is winner. But still here we announced main 3 winners. For the poster presentation, the rank third goes to the poster number 9. That is, she is Mrs. Aisha Mujawar. Her topic was I request her to come forward. Topic was artificial intelligence impacts the health space and health, which entries the mental well-being. And I request Dr. Suresh Ray, sir, in charge principal, Bharati Vidyapeeth College of Nursing, Sangli. Unka hai first or second? Yeah. The rank 2 goes to the poster number 1, Dr. Mr. Umesh Nanga. The topic was empowering public health nursing through the artificial intelligence. I request him to come forward and receive the award. I request Dr. Bhagyashi Jogdev Madam, in charge principal, Bharati Vidyapeeth, named to be University College of Nursing, Pune, to honor him with the certificate and the memento. And the rank first goes to, any guess, poster number 1 to 16? Poster number 12, that is, she is a Mrs. Prajakta Kambe, and topic was AI innovation, ethics, and impacts in healthcare settings. And I request Dr. Vaishali Jadhav Madam, Dean Faculty of Nursing and Principal, BVD Con, Pune, to honor her with the certificate and the memento. Thank you so much.
Now I request Mrs. Sindhu Gaikwad, Faculty of Nursing, to announce the winner and participants of paper presentation.
For paper presentation, 16 member have taken participated. We have taken 3 numbers. Judges were Sunil sir and Dane sir. I announced the third number. 2 numbers are there. And I call our principal sir to present the prize for the first, that is Prerana Ramesh Agare, Ashok Rao Mane School of Nursing. Suresh. One more number is for third number, that is Rushali Omkar Salunke. IMRDA Sangli. Yeah. She is a non-nursing person who has presented the paper in our conference. Second number goes to Dr. Umesh Nandgaon, Belagavi, Kelly Belagavi. I request Bhagyashree Madam to present the prize. First prize goes to Pallavi Patil, that is BVDU Medical College, Sangli. Sir, someone have to come and take because she informed that she is not available today. Yes, and I request Vaishali ma'am to present the prize. Thank you, everyone.
Now the certificates will be distributed college-wise. Any one delegate from the college could come and collect the certificates on behalf of their college. First, Bharti